more, but yeah. So I don't know. Did you get to catch the whole video yesterday, Tian, with the how good leaders inspire action?
Good leaders inspire action. I
Remember
think I
yesterday?
missed that. Was it the last video?
Yeah, the last video I showed. No, you didn't get that one?
No, I missed that one. Could you send it?
Yeah, so it's all in the resources.
Okay.
So if you so I'll show you. I'll do a screen share with you real quick here since I got you. So if you go to your email,
Mm-hmm.
and I'll just pull it up here real quick, show you. Now I want to make sure you got it, first of all. So the subject is going to be VYCC resources, OSHA 30, PMP, logistics supply chain specialist. Did you get that email from me, from Arlau at VY Career?
Topic.
Yeah. It's gonna,
yeah, is it supposed to be something attached to it, or is it?
no. They're all just links. So in that,
let me see.
so inside of that email, right, you'll have the this is the first link, and this is a Google Drive link, and it has all of the slides that we've had in the class. All right, so you have them digital versions online. And you have the book, right? Or did we give you the one of the
Yeah,
books?
I have the folder.
Perfect. Okay, so that's good. That's yours to keep. You know, when you come tomorrow, you don't have to bring that with you.
Okay.
But it's helpful to review. I mean, we have the review material. So if you wanna just take out like the practice exam, right? Just bring that with you. I think you guys already did a review before, and so yeah, just take that portion with you tomorrow, so you can when you do the review in the morning, you're ready to go with the project management. It's just a refresher, and then it'll be cake. It'll be pretty easy. All right, so that's the link for the Google Drive, and here's the link for the training videos I use inside of the OSHA 30. Right, so if you click this will show up, this playlist right here, and then you can go all the way down. There's 3 videos at the very end, and the one you know, it might make more sense if I did this. Huh? Oh no, I have to, well, so I showed this one on day 1. This was I showed this on day 2, and then yesterday I showed this one. And it's all from the same person. It's Simon Sinek. His work pretty much is centered on corporate culture, leadership, management. So he's got a lot of great books that he's talked about. And while there are some that are military he uses military examples, because there's a lot of good examples from the military. That's the reason why he uses it. He uses it in comparison to corporate culture, right? And you know, and it's if you really think about it, it's kind of it's a phenomenon of a sense, right? Like we have this, it's a US military situation, and we have this culture within that US military. You know, there's good and bad, you know, there's both. There's, you know, we hear some bad stuff too, like that happens in the military. But if you think about it in comparison to corporate culture, American corporate culture, and then, you know, you see this like, did you catch that other video? The one that says the why good leaders make you feel safe. This one right here.
Yeah, I caught that one.
All right. Yeah, so that one, right? So with that video, he spoke about, you know, if you're working in with your employer, you know, what's the few characteristics that make you feel like, okay, look, you can be your natural best on the job. And I think that feeling safe at work mentally, right? If you feel like your company is going to protect you, right, then you feel like, hey, look, I'm gonna work hard for the company, right? So that's another very important layer. All right, so I have Chris. Good morning, Chris. I got you on. So I was here. Let me, since I got both of you guys on here, and I don't have the rest of the class yet, you're gonna get a little freebie leadership course right here that I learned. So the videos help. Okay, so remember that the videos help. I'm gonna stop share real quick here. Oh, why is that? Oh, there it goes. Okay. All right. So you guys see the board, right? All right. So this is layer 1, right here. This is the biological level. So what do I mean by biological, right? So I was talking to you guys a little bit about neuroscience, right? So how we respond to stimuli, like things that happen to us, if we're under threat, if we're experiencing we're going to get harmed, right? Cortisol is released because it tries to save us from being mauled by a lion, for instance, right? So or it's going to cortisol will help us stay on alert when it comes to workplace situations. Like, think about this, right? On the job, if you're if you're staying on guard when you're on the job, right? What does it mean? Well, it means that you don't feel safe in your environment, and you're always going to feel like you can't do your best, right? Like, even though you try your hardest, and then the manager still tells you, oh, you still did it wrong, and then no one's really showing you how to do it, then you don't feel great about that. So that's the biological level, layer 1, right? So now we talk about the psychological level, right? Or you could say layer 2, right? And when you're here, so you need to have that physical safety right here, because it's our minds and our bodies, right? But over here, you need that mental safety. So that's so they layer from each other, right? And then the layer 3, right? So it's you could say overseer, okay? Because if you're at this level, right, and these are where, like, understanding comes in, right? So a lot of managers, they can get to layer 2 very well, like a lot of good managers, a lot of layer 1 managers never get past, what I mean? They don't get past that level of, like, understanding what mental safety means for people, right? Like, that's, so these are, when we talk about managers, like leaders. Hey, good morning.
Good morning, excuse me.
Yes.
I'm not sure one of your clients might be sick. I don't know if he has COVID or not, but he's asking for a reschedule.
Okay. He's a makeup anyway.
Right.
So yeah, I just let him know. I mean, he called in.
Yeah, I just spoke with him. I
That's
told
cool.
him, I
Sure,
put
sure.
him and told him. I'd come back.
I guess
That you do reschedule or talk to Miss.
no. I'll take, yeah.
Okay.
I could take care of it. That's fine. Thank you.
Yes, sir.
All right, so let's say managers, but I talk more about leaders, right? Because I mean, managers is a title, leader is a role, right? Think about what I just said there, right? Manager is a title, leader is a role, right? So manager is a title given to a person. Hey, you're a manager of this. You're a manager of that. You're a manager of documents, right? You're a document manager, right? Hey, good morning, Mia. How you doing? Doing a little quick.
Doing great.
All right, good. Doing a little quick session, leadership mind meld session here. So I wanted to just kind of bring you up to speed here. I'm talking about managers as a title and leader. I'm not sure when you popped in, but managers as a title, and then leader is a role. So in that video, the how good leaders make you feel safe, right? Like leaders, the leaders lead because they go, they do it first, right? Leaders are leaders because they take the risks, right? So if we understand this as leaders, right? Layer one, 2, and 3. This is I can honestly tell you right now, I'm not even like I am making this up right here. But what I'm using is all the stuff that I've read, all the stuff that I've experienced, and I'm rolling it into this little taco, the burrito right here, right? It's yeah, I said burrito, because it's rolled into one. Because you put all, burrito, you put all kinds of stuff in a burrito, right? And then you make it good. So this is what I'm telling you is what I'm trying to do here is have you guys see that physical, right? This is physical, mental or non-physical. You could say non-physical too. Okay, so physical, I'll put right here. Right, layer 1 is physical, layer 2 is non-physical, layer 3 is overseeing, right? That you understand 1 and 2. You wouldn't be at layer 3 if you didn't know layer 1 and layer 2, because if you're missing a layer 2, you can't get to layer 3 either, right? That's very important. This you have to have both layers there, 1 and 2, to get to a layer 3. Right? So, that's understanding. So what is this really, right? Understanding. It's called, anybody know? It's called EQ, or emotional intelligence. I can tell you right now, with the landscape changing, with COVID being here, looking like it's gonna be here to stay, that we have to adapt to it, right? We've got to do this better, right? And then the reason why you do this better, what does a good manager do, right? They retain people. That's gonna fall under retention. Okay, and then I'm gonna flip this for you guys. It's gonna blow your mind. I mean, maybe, right? If you remember yesterday, I started with do you guys catch the layers I drew, right? Remember the boxes? I did the 4 layers, right? Of with the Mayan pyramids.
Yeah, and it had the OSHA, DMP, OPS, and CF.
Right? Okay, good. So you remember that. Okay, so good. So that's the industry that you're in, right? And the customer service and sales, right, is actually what we would call your external customers, right? So the customers you service outside your organization, right? But now think about this role, what's called managers, right? So think about it like this, okay? If your CSRs take care of your customers, right? And then you got to say, well, if your CSRs take care of the clients, well, who takes care of the CSRs? Who do you think takes care of the CSRs, or who should take care of the CSRs? Who's that individual in the company that's supposed to take care of the CSRs? Take care of them in the sense of provide them what? Scheduling of their hours. Tell them if they're doing well or they're not doing well. Support them if they need the assistance. Give them proper training. All right. So now do you know who's the title? What's the title I'm looking for? Who's the person in the organization that's now needs to take care of the CSRs?
The supervisor?
Supervisor, right? Supervisor, manager, or leader, right? So that's the one thing that a lot of people don't understand, right? The people don't work for the manager. They work for the customers, right? The managers, they work for the employees. So so Simon Sinek, right? What he says, the way he puts this into his talks, right, is that managers, right, are not in charge of people. People are in the manager's charge. Okay, so when you change the word manager to leader, right? Leaders are not in charge of people, right? People are in the leader's charge. So what am I saying there? Well, meaning to say that you as the leader, you have to care for your employees. That's you know what I'm saying? And think about that, right? Remember I asked you guys like in the sometime in this training, what if you were to remember an attribute or a characteristic about a manager that you absolutely loved or adored or you really you like working for, what were those qualities, right? Well, and then I think it was day one. I think so some people said, well, they took care of us, right? There you go. See that right there? And what does taking care of us mean at this level, at the layer 1 level? It releases oxytocin. Right? When you can't see the rest of that word, but it releases oxytocin, right? When you release oxytocin in your corporate, in your company culture, right? Then the managers do a great job of conveying, of making people understand that the managers got their back. Right? Those are the best. And you think about it, there's a connecting theme there, right? So, and it's about the culture of the company. And it's not really about the company, right? It's about the manager that's overseeing that, right? Because your manager may be taking you may not realize it, but the manager could be also absorbing criticism from their superiors, right? Maybe production is kind of low, but he understands that there's some changing point that they have to consider, and he's giving the people time to adjust, right? So I'm just saying that this is it's a broad look, right? But if you think about what we have already seen in our own experience, I think you can say, you know what, it's helpful to know that as a leader, you're going to have to think about, okay, look, I do have to report to my bosses. I have to give them reports, I have to do all this for them, but I gotta, if I can make sure that the people that I am responsible for, that they know that they can count on me as their supervisor or their leader, right? Watch what happens. Watch how much trust you build with your people, right? Especially when you do things when you do things that you say you're going to do, right? And those managers are out there when they're like, hey, you know what? Yeah, no problem. I got that, right? I'll take care of that. And then they do take care of it, right? And you're like, okay, cool. Hey, that's awesome, right? So, and that's in a consistent way for people to keep doing that, right? It's very, very it builds a reputation, right? It makes you a stronger leader, right? So I want you guys to, I just thought of that right now, as far as layer 1, 2, and 3. But I mean, all this stuff in my head has been a continuous process of growth. Now, would I say, is this like all inclusive? Is it total? Is it like definite? No, it's not, right? It's my experience rolled into what I have read and what I have also heard of and incorporated that into my understanding. So you can take this for what it's worth. And I think that what it can bring you, right, is the level of understanding about people. And if you understand people, right, that's also a quality that is a parental quality. Because if you understand kids, it's like, think about it like this, right? If you have kids, and if they're up to, like, I don't know if you maybe nieces or nephews too, that you've seen grow up, right? At some point, you gotta let the kid be the kid with certain, restrictions, with certain guidelines, right? If they do something, like if they walk up to a kid and just smack them in the face, I mean, you're probably gonna stop them, right? You're not gonna let that keep happening. So my point in saying all this is that when you have a perspective, right, that's a well-grounded perspective, right? And what perspective am I talking about here? The parental perspective. If you have a well-grounding understanding of that parental perspective, transfer that into leadership and management, and you become a better leader and manager, right? This is what this all means. It really does. That's about it. Like, and I can tell you right now, I would not dare say I am the best parent, but I think I do enough for my kids that they're good, that I believe I have maybe have provided a little bit better than what my parents did for me. Like, you want to do better for your kids, right? And that's what I feel like, at least I got them a little bit better than what I experienced growing up, right? That's the result. That's kind of where I think if you bring that mentality into the workplace, like, hey, you know what? I want my co-workers and my people I'm in charge of, or people that I supervise, that's a title, that I want them, to experience something better than I experienced at my last job. It's a good mentality to have. Imagine, look how far. Here's okay. Let me give you some background just really quickly before we continue on to Osha. Right, this is a good one. So at Charter Communications, when I first got out of undergraduate, my college, I graduated from DeVry with a computer programming degree, right? I think I told you guys this. So I didn't do a lick of computer programming. I got hired into Charter Communications in 2004, right? So that, and in less than 6 months, and I was a brand new associate. Remember, I'm a new hire, right? I got into the company in less than 6 months. I was hired in as a tier 1 technician, like a customer service technician, like a high-speed internet, right? Support, right? And that, I came in, a little higher than the regular CSRs. So, but in less than 6 months, I got promoted to lead advocate, which is basically the supervisor position. And what I brought to Charter as a mentality and a mindset was, it was funny. Before I ever learned the Mamba mentality, right? It was like embedded. I felt it, right? Because to me, in my mind, I was like, you know what? I am not gonna let any of these other guys outwork me in this training class. We had a training class, and so I went to work. I became meticulous at the craft, and there was a process. You know how like they give you a script. I don't know if you ever worked in a call center before, but they give you a script to follow, right? Or like a format. So I basically adopted that format, ran with it. They saw me become a good example, and I kept on getting a lot of 100% calls, quality assurance calls. So when someone monitors your calls, and then they want to make sure you hit all of the buckets in a call, and then of course and that you get a little spiff. They give you $20 for a 100%. So it's like it was an incentive to make sure you did all that, right? So 4 months, they were like, yeah, you know what, we're going to consider promoting you to be a lead advocate because you're basically, I was like, it was a great surprise, but I knew I put the hard work in, and looking back in retrospect, I let it all out there. I didn't even, even though like, I didn't know like 2 years later, they're going to close down the call center and then ship all the jobs out of California, right? I didn't know that, but I was like, you know what, this is a great company. We got free cable. They gave us a free cable with one free DVR. So you got the telephone service, the landline service that they give you, the internet service, and all of the channels. They don't do that now. Like Spectrum, like the company Spectrum, they don't do that now. But they did it back then for the employees there. So I was like, you know what? I'm gonna bust my butt, work hard for the company, and look where it got me, right? Like how in a short amount of time. I mean, think about it. I mean, there's big companies that are probably not going anywhere. Yeah, things change, but that experience, like no one can take away from me now. Like that experience and that knowledge that I know, like I can go to a company, hit the ground running, and then be like, yeah, we're gonna promote you right away. And that there's a lot of elements there that I rolled into this. And without even realizing it at the time, right? But now that I can pass that knowledge on, right? I think it's beneficial for you guys to know. Like doing a good job is great, right? But doing an awesome job is better, right? Right. So I think that's my mentality. So I hope that gives you some inspiration, hopefully, to and hope, like, what I'm really hoping is that you guys learn more for yourselves. That's really my end game goal for you, is hopefully you guys can get motivated to learn more for yourself, right? Because that's, no one else is going to do it for you, right? Bottom line, no one else is going to do it for you. So if you don't do it for yourself, you gotta do a self check. You know what I mean? A self diagnostic. Make sure you're alive. make sure you know what you're living for, right? You gotta be alive to thrive, right? If you're not alive, I mean, even though you are living and breathing, right? But if you're not alive inside, it's hard to thrive. It's hard to feel like you're actually, being feeling like you're accomplishing things. That's why it's helpful to teach yourself how to look at how to plan, how to make goals, and then accomplish them, because that's dopamine released to your body, and it motivates you to keep going, right? It motivates you to keep going. So yeah, all right. We are going to jump back in here into industrial hygiene, where we left off yesterday. And we are now at the physical hazards with radiation. Okay, so let me start the slide here. So if I can just do a quick recap for everybody here. We started this, well, we're looking at the physical hazards, right? And we're at radiation right now. All right, so right there. So we did temperature, hot and cold. So we are at radiation. Okay, and with radiation, you have your non-ionizing, right? Non-ionizing right here. So what is non-ionizing? It's things that aren't supposed to hurt. I say aren't supposed to hurt because if you guys remember when COVID started, right? I don't know if you guys remember this in New York, they were saying there were people complaining that the 5G towers were spewing out COVID, and that's why everybody was getting sick. And yeah, I don't know if you remember that. That was I thought that was, you do. I thought that was hilarious. But yeah, I mean, you're in tight quarters, and people are walking around and coughing and sneezing and poor ventilation. So yeah, that's why people got sick. That's non-ionizing radiation. And then you have ionizing radiation, where if you go to your dentist, right, and then you have to wear that lead vest so that you don't get, you don't absorb all that radiation, right? So that's ionizing radiation, more on the lighter side, but they take precaution. But of course, as you go into the deeper spectrum, then yeah, you're hurting yourself in this area right here. Really worse, right? Okay. So radiation. If you're dealing with, and this is just give you guys an example of a more relevant to yourself, right? Because I don't know if you've ever worked with radiation on the job, but if you remember the last time you've ever been to the dentist, right? And you go through the process of staying within the lines. There's there's like glass around the area too, right? And then there's like markings on the floor, and then they put that lead vest on you, right? So yeah, engineering, admin, PPE, right? So you do all of these steps to make sure that you identify if there's ways to physically block radiation, or there are ways, but you have to make sure that when you're beaming any kinds of radiation, that you're protecting by engineering first, admin, PPE. So remember now, hierarchy of controls, right, is always something that you should always remember as a safety manager, supervisor, coordinator. Hierarchy of controls. All right, so vibration is next. So we talk about what are the health effects, right? Signs and symptoms, and advanced symptoms. Right, so if you're dealing with a lot of vibration, for example, forklifts, driving forklifts for a long time can be a big source of vibration, especially when, you know, there's like the older ones that don't really have good shock systems, and it's like really vibrate you whenever you move, right? So yeah, there's that. Or could be actually jackhammering, which is worse, right? And then that's prolonged exposure. So when I start to identify people that are doing a lot of work that could bring vibration, right? The first signs is pretty much blanching of fingertips, where, you know, they get really pale, right? And then also pain in the fingers. And then the later symptoms is shooting pain, severe pain, loss of grip strength. That's a tough one, right? Because as you know, as you lose your grip strength, then that's if you're doing a lot of manual labor, then you gotta stop doing manual labor, basically. All right. So protection is, think of engineering as minimizing however much vibration exists. Right, so that's your engineering steps, or how you would shield an employee from vibration. And then an admin controls will be proper positioning, and also letting the machine do the work, right? And PPE, the only thing that's available really are anti-vibration gloves. Now noise, you have your tinnitus, ringing in the ears. So if anybody ever was in the military for tinnitus service connection, means that pretty much that you're always hearing ringing in your ears. That's tinnitus. So symptoms earlier on is the ringing in the ears, and then of course later on you have diminished ability to hear high frequencies, right? And this is kind of like you can thank God that designed this type of a system, right? You know, like, and actually some men actually do thank God, because when they can't hear their wives anymore, because they're high frequency, women's voices are in the high frequency, and if men lose their high frequency ability to hear, or is diminished, right? Then you're like, what'd you say, honey? Huh? I didn't hear you, right? And then it brings more psychological stress, right? Then your wife like yells at you like, hey, you don't listen to me anymore, stress you out. So there's that too, right? But on the job, make sure when there's a lot of noise potential. I don't know if I showed you guys the sound meter yet, but we're pretty much there. I don't know if I don't think I did show you, huh? Okay. Oh, I know why, because I didn't do the PPE section. It was I had Art do it. That's why I didn't show you. Well, since we're here at noise anyway, take heart. There are free apps. Now, some of those free apps will advertise to you, of course, but I wanted to share with you this app I use. All right, so I know that there's the ad on top right there. But this one here is cool because as you see me talking, right, you get a minimum, average, and a maximum, right? And this gives you, see the bottom bar right there, like the little reader, or it's like a history tracker basically. So this keeps 30-second increments, and it'll just keep moving, right? And then you can take screenshots of this and provide it to management or whatever. Say, hey, look, it's pretty noisy over here. We're getting close to 90. OSHA is going to require hearing protection, right? And so this is just an easy way for you to gauge how noisy it is on the job, right? Using your phone, right? So I wanted to share some resources with you guys. It's always good to know about resources, right? And sometimes you just don't know what you don't know, right? And if you don't know what you don't know, can't help you, right? All right, so that's a sound meter. And so at 85, prolonged exposure is dangerous actually. But and NIOSH, you remember the science agency of OSHA, right? That's they recommend it at 85, right? So, you know, if you at least offer it to the people, some people will be like, oh yeah, sure, I'll take it. Or some people will be like, no, never mind, you know, and then, but see, what does that do for the people, right? It'll make them feel like you got their back, right? Again, oxytocin release. You want to generate that kind of feeling for people on the job because that makes them feel more safe, right? So when you little things like that, right? I want to point those out. So how do you go about reducing noise when it comes to the hierarchy of controls? Well, when you think about engineering, think about what I can make or how I can increase the distance between the noise source and the worker, right? That's engineering, right? So these are all of those bullet points that describe those activities, right? So for admin controls, okay, so we increase the distance. So that's where admin control is where someone's got to do something, right? Whereas engineering, you create a barrier, right? So there, you know, so admin is, you know, standing a certain distance from the noise source, limiting the amount of exposure to the noise source, right? Providing quiet areas for rest breaks is also a good idea, great idea, right? Sound pressure levels, right, are high, so you know, and they push on the ear. So if you go to a room where there's, you know, it's really quiet, then the ears get relief, right? And so it's kind of like if you're working out, right? You know, you work out really hard and then you take a rest day, right? And then of course PPE, earplugs, earmuffs, pretty much physical protection, right? All right, so you I remember just mentioning that to you guys. 90 decibels for OSHA, 85 for NIOSH, right? And then here are the various types of hearing protection gear, right? So this is what's called noise reduction rating. Okay, and you always want to consider how much noise reduction a device can do, especially in the environment that you're in, right? So, all right, so that's for hearing. So ergonomics, we already pretty much covered this, so we're not really gonna do too much here. Okay, we're good there. Okay, all right. Okay, doke. All right, so let's do a quick knowledge check and finish up industrial hygiene, and then we'll get to bloodborne pathogens and more interesting. Well, it's more interesting to me because I don't really necessarily deal with it, or I've never actually been in the medical field. So, all right, number one, which of the following is an example of an industrial hygiene health hazard?
A.
All right, good job. Yes, it's a chemical hazard. All right. Because what are, so what is, well, economic hazard is not really, not something part of OSHA anyway. What would be electrical hazards? Right, so well, electrical hazards, anything from installations or any type of, so those are not necessarily health hazards. So fall hazards are that. Okay, number two, which of the following is an example of a physical health hazard?
Either think A or C.
No, actually, you missed. It's right in between. You missed. So physical. So okay. So here I'll give you a reference, right? So
Wait, it's lead, no? Because it has to be material. Material, is that like a materialistic thing, right? You mean
no.
physical?
So yeah. So there you go. That's let me go back to this slide right here to show you guys. Right. So when you talk about physical health hazards, right? It's going to be all of these. These are your physical hazards, right? So if these are physical, right? Does one of those options fall in there? So what is it?
Wait, so it'd be noise?
Noise, right? Because what these other three are actually chemical hazards.
Oh, I see what. Okay, I see what you mean.
Right? They're chemical hazards, not physical hazards, right? So you got to remember physical versus, so what's the difference between physical and a chemical hazard? So physical is actually something that's going to happen to you physically, right? So something that's going to happen to you either by your movement, either by exposure to temperature or radiation or vibration, right? Or noise. That's something that will physically happen to you, right? You're going to get affected by that versus chemicals, right? These are your health risks, right? They're a little bit different. Right? So it's a good distinction. So to understand, right? So it's noise. Okay. Number 3, which of the following controls is an example of an engineering control for protection against chemicals? So remember what engineering is supposed to do? You're supposed to make something. So what's an engineering control where in this list you have to
Respiratory B.
no, well, respirators you buy. That's
Okay. Well, someone makes a respirator and you buy like.
well, yeah, but
Okay,
then
I see what you mean. I
yeah,
see.
but you don't engineer it on the job. This is a you don't engineer this at your workplace. Like you don't necessarily, your company your company is more than likely not in charge of making respirators unless you're a company that makes respirators, right? That's different. Engineering, so where engineering controls, you have to actually make something or build something to make it more safe for the workers. That's what engineering controls
Maybe
do.
A.
Yes, A, ventilation. All right, so we said respirators are PPE. What is training and signage considered a control? What kind of control is training and signage? Now I know you still have to make it, right? Like you have to make the sign and make the and then do the training, right? Or make the training materials or whatever. But what category does specifically signage and training fall under?
Is training part of MSDS, I think, or
Well, what level? The hierarchy of controls right here. Which level? So remember the hierarchy of controls right here. This one, this thing right here. What level is it? Is this here's engineering? Is that elimination? Is training and signage elimination? No, right?
it's gonna be ADM, right? Or
Yes, admin
admin.
or administrative. The way how OSHA says, or people just say admin controls, but administrative controls. But yeah, that's those other levels. Oops. Right. So I want you guys to be able to distinguish them, right, of what they are. So that way you sound like you're smarter when you can distinguish the different types of controls. All right. So remember that. So yeah, this one is A is ventilation. You don't get very many questions on that. So in this slide deck, that's it. That's all the questions we have. All right. So any questions on industrial hygiene? Anything I can explain a little bit more for you guys, but just remember when you're dealing with, so industrial hygiene is fairly broad. I'll see this here, right? So industrial hygiene is strategies to control chemical, biological, physical, and ergonomic hazards. So this slide deck by itself, this industrial hygiene, covers a lot, because once you get into chemical hazards, right, then you have to have a HAZCOM, right? HAZCOM standard or HAZCOM, HAZCOM standard or hazard communication, right? Protocols or HAZCOM program, right? That's what I was going at, I guess. Biological hazards, we're gonna go into this one next. It's blood-borne pathogens, right? And there's other biological hazards too. And then physical hazards, right? And all of these if you're dealing with any of these, let me go back to the physical list. There it is. All right. So once you get to here, you have to have a heat program. You have to have a heat and cold program if you're especially if you're dealing with a lot of it, right? Physically. Radiation, you have to create some kind of a program to make sure that if you're like, let's say if you have a dental office and you have employees, then you have to create a program to address, how to control radiation, right? And then of course, for anything with vibration, right? You have it's an ergonomics program, right? And then with noise, you have to have a hearing conservation program, right? So that's all kinds of different programs that you need to have. But basically, what a program really does is it brings together all of the elements that are required to make sure that people are being protected completely. Even though some elements overlap, right? Like, I mean, one example is PPE. PPE is used in all different parts of OSHA, right? So, but let's say like, and in the hearing conservation program, you're using earplugs as your PPE, right? So you have to describe the hierarchy of controls in the hearing conservation program and use it, and then you're describing all of your techniques and tools that you're using to protect workers from noise, right? So you go whatever engineering, engineering protocols or whatever you have to do to reduce noise. You're installing these sound absorbers or whatever, right? Like that. So that's one example. All right. So bloodborne pathogens. I got a video to show you, which is going to be like under 9 minutes, and it's the same guy that did the hazard communication video. That's from the same company. So this one's good. I like this one. Very comprehensive. Very well explained.
What are bloodborne pathogens? They're microorganisms in the blood or body fluids that can cause diseases in people. The two most common bloodborne viruses are hepatitis and HIV, the virus that causes AIDS. Why are you receiving this training? It's possible for employees in non-healthcare related industries to encounter items or situations involving contamination with blood or other potentially infectious body fluids. Who's at risk? Everyone who comes into contact with human blood or bodily fluid or materials contaminated by them is at risk of exposure to bloodborne pathogens. The type of bloodborne pathogens most likely to affect the general public are hepatitis and HIV or AIDS. There are three major types of hepatitis, and all of them affect your liver. Some of the symptoms are similar, but they have different treatments. Hepatitis A. This type won't lead to long-term infection and usually doesn't cause any complication. The liver usually heals in about 2 months. It can be prevented with a vaccine. You get hepatitis A from eating or drinking something that's got the virus in it. If you have hepatitis A, your doctor will carefully see how your liver is working, but there aren't any treatments to cure it. Hepatitis B. Most people recover from this type in 6 months. Sometimes, however, it causes a long-term infection that could lead to liver damage. Once you've got the disease, you can spread the virus even if you don't feel sick. You won't catch it if you get a vaccine. There are several drugs that treat long-term hepatitis B. You can get hepatitis B if you have sex with someone who's been infected, share dirty needles when using illegal drugs, have direct contact with infected blood or the body fluid of someone who's got the disease. If you're pregnant and you have hepatitis B, you could give the disease to your unborn child. If you deliver a baby who's got it, the baby needs to get treatment in the first 12 hours after birth. Hepatitis C. Many people with this type don't have any symptoms. About 80% of those with this disease get long-term infection. It can sometimes lead to cirrhosis, a scarring of the liver. There's no vaccine to prevent it. Just like hepatitis B, you can get this type by sharing needles and having contact with infected blood. You can also catch it by having sex with someone who's infected, but that's less common. For hepatitis C, some people improve if they get a special combination of drugs, but there are side effects to this treatment, including severe anemia and birth defects. Your doctor may also suggest other drugs for hepatitis C, which cure more people and may be better tolerated. The blood used in transfusion is safe. It gets checked beforehand to make sure it's free of the virus that causes hepatitis B or C. There are additional strains of hepatitis not covered here. Symptoms of hepatitis. What are the symptoms of hepatitis? The most common symptoms for all three types are dark urine, stomach pain, yellowing of the skin or eyes, pale or clay-colored stool, low-grade fever, loss of appetite, fatigue, feeling sick to the stomach, and a lack of nutrition. If you have hepatitis B, you may also have achy joints. See your doctor as soon as possible if you have any of these symptoms. HIV. HIV stands for Human Immunodeficiency Virus. If left untreated, HIV can lead to the disease AIDS, or acquired immunodeficiency syndrome. Unlike some other viruses, the human body can't get rid of HIV completely. So once you have HIV, you have it for life. HIV attacks the body's immune system. If left untreated, HIV makes a person more likely to get infections or infection-related cancer. These infections or cancers take advantage of a very weak immune system. No effective cure for HIV currently exists, but with proper treatment and medical care, HIV can be controlled. The medicine used to treat HIV is called antiretroviral therapy, or ART. If taken the right way every day, this medicine can dramatically prolong the lives of many people with HIV, keep them healthy, and greatly lower their chance of transmitting the virus to others. Today, a person who has been diagnosed with HIV, treated before the disease is far advanced, and stays on treatment can live nearly as long as someone who doesn't have HIV. The only way to know for sure you have HIV is to get tested. Testing is relatively simple. You can ask your healthcare provider for an HIV test. Many medical clinics, substance abuse programs, community health centers, and hospitals offer them also. AIDS. AIDS stands for Acquired Immunodeficiency Syndrome. AIDS is the final stage of HIV infection, and not everyone who has HIV advances to this stage. AIDS is the stage of infection that occurs when your immune system is badly damaged and you become vulnerable to opportunistic infections. Without treatment, people who are diagnosed with AIDS typically survive about 3 years. Once someone has a dangerous opportunistic illness, life expectancy without treatment falls to about a year. People with AIDS need medical treatment to prevent death. Prevention of blood-borne pathogens. Take universal precautions. According to the concept of universal precautions, treat all body fluids as potentially infected. Don't share needles, razors, or anything that could contain blood. Practice safe sex. Always wear appropriate PPE and always wash your hands after potential exposure. Disposal of contaminated materials will only be handled by qualified employees. Any contaminated material must be double bagged in bright red colored bags. A biohazard kit has all the necessary equipment to properly clean and disinfect biohazard sites. Exposure control. Universal precautions will be used to prevent contact with blood or other potentially infectious materials, including all body fluids. According to the concept of universal precautions, all body fluids must be considered potentially infectious materials. Potentially exposed employees shall wash their hands and any other exposed skin with soap and water, or flush mucous membranes such as eyes with water immediately or as soon as feasible following contact with such areas with blood or other potentially infectious materials. Exposure reports. An exposure event is a specific eye, mouth, other mucous membrane, non-intact skin, or parenteral contact with blood or other potentially infectious material that results from the performance of an employee's duties. If you feel that you've been potentially exposed to a blood-borne pathogen at work, contact your supervisor so that an exposure report can be made. Once this confidential report is made, hepatitis or HIV testing will be made available. Statistics. There are 140,000 to 320,000 infections from hepatitis B each year. These infections result in 140 to 320 deaths per year from acute illness and 5,000 to 6,000 deaths per year from chronic liver disease, including cancer. Hepatitis C affects 4 times more people than HIV. It's estimated that 4 million Americans may be infected. Every 15 minutes, someone in the US dies of AIDS. Review. Always practice universal precautions, and that is to assume all blood or body fluid is contaminated and protect yourself. Trained personnel only will clean up and contain all biohazard materials. A carrier of bloodborne pathogens will not always exhibit signs or symptoms. Not all bloodborne pathogens can be cured, and you're more likely to be exposed to hepatitis than HIV.
All right, so that's our bloodborne pathogens video. All right, so bloodborne pathogens. Oh, let me Oh, so just to make a quick announcement, so the majority of you, except for Chris, is going to be taking the project management exam tomorrow. So, so tomorrow, I wouldn't, you don't have to bring your book with you, but I suggest do bring your study guide, the practice exam guide, because you've already got the answers for it there, and then Chief will be here tomorrow to do the review with all of you, right? And then get you all prepped to take it, and then take it, and then be done with it, get your certificates, and have a graduation presentation. Also tomorrow, is anybody here allergic to gluten? Because I'm going to bring some bagels. I'm going to bring some bagels with cream cheese for everybody tomorrow. Is everybody okay with that, or is there?
I don't do gluten.
You don't. Oh, you don't do. So I gotta bring some gluten-free choices. Okay. All right. So but everybody else is okay with it. So what do you usually eat in the morning?
Yeah, I'm fine.
Fine with that.
Thank
Okay.
you.
Thanks, Chris. Yeah.
Good.
Yeah. You good with that?
Yeah.
Yeah. Awesome. And then for yourself, Mia, right? You're okay with the bagels and cream cheese in the morning?
Yeah, that's fine.
Okay, cool. And then we have our coffee here and everything for everybody, so feel free to get that.
Y'all make me sound bougie.
No. Well, I mean, that's it's not a no, definitely not. I mean, it's a health, a lot of people, when we make health choices, it's not about, we gotta be accommodated. Now, what I'm just wondering though, but what do you usually prefer?
I usually do like egg, like burritos or egg sandwiches, stuff like that.
Oh, okay. All right. So, actually, have you ever had those egg bites from Costco? Like they're pretty good. Like they're all there's like the egg white ones, and then there's like the ones that have like the bacon in it, but I don't know if you do bacon.
I've definitely I've tasted those before, but I've never tasted them from Costco.
The one, yeah, they're actually called egg bites, and there's a white egg white version where they just have the egg white and some there's actually like does cheese have gluten in it? No, right?
I can't do cheese. It's dairy.
So you do like an egg sandwich.
I'm allergic to. Yeah, I could do an egg sandwich just without cheese. It's just the gluten and then the dairy, because I'm lactose intolerant as well, unfortunately, because I love cheese. I love the smell of cheese at least.
Oh, I see. So then, I see. So then, because yeah, you know what? Einstein bagels, they do have. I'll talk to you separately. Okay, that's cool. All right, so bloodborne pathogens. Let's jump in here, and I want to make sure that take care of my group. For every class that I do, like OSHA, then yeah, OSHA 30, I always make sure that, I do one thing nice for you guys. All right. So bloodborne pathogens. We're going to talk about also in this slide deck is we're going to be discussing a little bit of COVID, right? And just discussing some origins and potentially there's actually all of the guidelines you can find on COVID are online pretty much through Cal OSHA. So, and it's pretty simple nowadays. The ordinances now are just, if you're dealing with a lot of public, then yeah, you want to continue masking up, even if you are vaccinated. But usually when people are, working with each other, they're all vaccinated. They feel more comfortable than, you're at your. No one's gonna police. You know what I mean? Like there's no police coming, no COVID police coming in going, oh, everybody got their masks on, right? It's not really. It's more of a control method for businesses. It's a lot of it is really left to the businesses to decide how they want to enforce it, and just kind of know businesses have because employees ultimately are going to be the driving factor, because if no one wants to come to work, then who are you really trying to cater to, right? It's the employees right now. So employees do have a lot of power right now. So understand that whatever role you take next, right? Just make sure that you're doing your due diligence and making sure that you understand longevity and with the company, right? How long you can last with the company, and also how well they treat their people. And I think if you go to glassdoor.com, you get a feel. I know that there's like I get the if anybody's ever used glassdoor.com, right? It's a website. Let me do a quick sidebar for you guys, just so I can. But if you guys are not familiar, and if you are familiar, great. But if you're not, then right here when you log, I think it asks you to log in. So I think am I logged in? Okay. When you look for a company, right? Let's say a bigger, like let's just say UPS, right? You should just be able to, yeah, the company UPS, right? See right here, you get a good snapshot. I don't really want to do that because I'm not a. Well, anywho, you can see it gives you like company rankings, and then you can also see. Let's see if this does. I want to get to a company page and then just see a company rate. Oh, this is 2.7. Yikes, right? Oh, listen, 5. There's it allows me to see the company. There, maybe this one. Company overview has 1,000 to 5,000 employees. Private company, founded in 94. Approve a CEO, 23%. Recommended to a friend, 36%. Colleagues are quite nice. Secure job, good benefits, PTO, healthcare. Less than average compensation for workload. So there's pro and con, right? Okay, they do okay with benefits, but they kind of work you. They work you. So I'm just saying, like you can kind of see companies right here. They're rated. Average base salary estimate. See, you can see like salary. You can see salary ranges. It's really useful, right? You want to use these resources for yourself so you can make a good decision on what you want to do, especially when a company is listed on Glassdoor. It's hard when they're really small, mom and pop shop. That it's hard to get a review, and if there is, it's probably not good. But okay, bloodborne pathogens. Let's jump in. I meant to go over the slide and not hit next. Okay. Defining bloodborne pathogens. The video, I think, did a great job of defining it. Okay, so we're good with definition, I think. We'll see more. Now we're gonna look at identifying workers at risk. Right, so who are the workers at risk? And again, if you're not going to work in an industry where there's a bloodborne pathogen exposure control plan requirement, it's still good to have the knowledge, right? Methods for controlling exposure. Okay, we're going to be covering that. And also steps to take when exposed to a bloodborne pathogen. Okay, so those are objectives. And through the time, we had these major, like HIV, right? HIV here to stay, pretty much. Ebola, it didn't really get too bad here, and then the Zika pretty much never really got here either. So those two were smaller scaled incidents, endemics, and then you have our pandemic of 2020, the coronavirus disease or COVID-19, right? So lots of stuff that you saw a year plus later, with all kinds of different news. But we'll take a quick look at, and I'll show you another video that I have from the CDC. Their last video was done on June in 2020, and they never updated it. But it's a good video. It's pretty informative, right? And it's good to know information like this. So, bloodborne pathogens, what are they? They are microorganisms that are present in human blood that can lead to diseases. Okay, so your Hep B, Hep C, and your HIV are the most prior COVID was our most concerning ones, right? So why Hep B? Well, Hep B or Hepatitis B, over 12 million Americans are infected, pretty much currently. And these are your symptoms right here, silent infection. So the one thing to really be careful of, and this is the reason why we practice universal precaution, right, is because HBV can survive for at least 1 week in dried blood, right? So just that fact alone, you should always make sure that you treat anything that even remotely, if it looks like blood, you should probably treat it like blood, right? And and even if it isn't, you're practicing universal precaution. If you're on the job, that's your right. It's your right to practice universal precaution because you're protecting yourself, right? 40,000 new people will be newly infected every year. I mean, that's been ongoing, right? I'm sure the numbers for COVID are way more. Hep C is the most common chronic bloodborne infection. And most of the time, your body can recover from this, no problem. But it could lead to chronic liver disease and death as well. So maybe sometimes your body can't recover from it. Okay, and then we look at HIV. And HIV, if you look at this picture and you zoom in, like I'm gonna zoom in right now, and you see those yellow specks, right? The yellow specks are actually, that's the virus. Right, so that's this is a red blood cell, of course, right? This is a, what do you call that? Microscopic. So HIV is the virus that leads to AIDS. So HIV is the virus, AIDS is the condition, right? So HIV affects the human body, your immune system. And this is why it's strictly a sexually transmitted disease, because it does not survive well outside the body. So the only way to transmit it is by bodily contact, right? Shaking someone's hand, you can't pass it on that way. All right, so, and you're infected for life. There's no cure. There is treatments to make you undetectable, right? But you gotta be careful with that one, right? Undetectable. All right, so COVID-19, we all have a pretty decent idea, right? Now, the one thing I want to just highlight here is that if you remember the beginning of the pandemic, we were still trying to figure things out. If you guys remember this too, right? People were wearing hazmat suits to the hospital, or like, doctors were covered in hazmat suits. They were pretty much, they were just still not sure how this disease transmits, and they were just taking the extra precaution, right? So what kind of guidance did OSHA give when it first came out? Well, usually when something of this type of similar, well, it's not similar, but but any type of release of disease happens, they will usually revert back to a previous time where there was a spread of something, or in this case was the MERS-CoV, the Middle East Respiratory Syndrome coronavirus. So, but luckily with the MERS too, right? It wasn't really wasn't widespread, but that was the guidance that of the most recent type of a disease spread happened. So they used that guidance. So you can only imagine in the future, since we've been through an actual pandemic now, or we're still in the pandemic, that if we ever had a new coronavirus come out, right now we're more, at least we're more informed. I don't know if you remember this, but people were like, oh, the Lysol can kill coronavirus. You know what I mean? And they thought that like, hey, I thought they thought that coronavirus was like a brand new thing. Like it's not. There are many different kinds of coronaviruses, right? So the flu is a coronavirus, right? But there's always mutations, and that's why we always get the flu vaccine every year, right? But so that's what happens. We revert back to previous guidance. So in the future, if we have another pandemic, 100 years later, we're going to use guidance from the most recent type of a coronavirus release. That's just how they do it. So don't have to read this. I'll play the video and actually can give you more information there. So I'll just show you the video. Okay, so this is the next video I have right here from the CDC. And just remember, this was made in June 2020 when they didn't have the vaccines available yet, because they had the vaccines available, I believe, the beginning of the year or something like that, right? Pretty close, to like the beginning quarter of the year anyway. So that's, but this video is still, minus that fact, current.
In December 2019, there was a cluster of pneumonia cases in the city of Wuhan in China. Some of the early cases had reported visiting or working in a seafood and live animal market in Wuhan. Investigations found that the disease was caused by a newly discovered coronavirus. The disease was subsequently named COVID-19. COVID-19 spread within China and to the rest of the world. On 30 January 2020, the World Health Organization declared the outbreak a public health emergency of international concern. In this video, we'll take a quick look at what is currently known about COVID-19. Keep in mind that this is a new disease, and what's known is rapidly evolving and might change in the future. So what is a coronavirus? Coronaviruses are a large group of viruses. They consist of a core of genetic material surrounded by a lipid envelope with protein spikes. This gives it the appearance of a crown. Crown in Latin is called corona, and that's how these viruses get their name. There are different types of coronaviruses that cause illness in animals and humans. In humans, coronaviruses can cause respiratory infections ranging from the common cold to more severe diseases. These include the severe acute respiratory syndrome coronavirus, first identified in China in 2003, the Middle East respiratory syndrome coronavirus that was first identified in Saudi Arabia in 2012, and SARS-CoV-2, the name of the virus that causes COVID-19 that was first reported in December 2019. So, where did this new virus come from? It's known that coronaviruses circulate in a range of animals. Sometimes these viruses can make the jump from animals to humans. This is called a spillover and could be due to a range of factors, such as mutations in the virus or increased contact between humans and animals. For example, MERS-CoV is known to be transmitted from camels and SARS-CoV from civet cats. The animal reservoir of the new coronavirus is not known yet. How does the disease spread? The disease can spread from person to person through droplets. When an infected person releases those droplets through coughing, talking, or sneezing, for example, when close to another person. It can also spread when infected droplets land on objects, and when another person touches them and then touches their eyes, nose, or mouth. What are the symptoms? The incubation period, which is the time taken from exposure to the virus and development of symptoms, is on average 5 to 6 days, but can range from 1 to 14 days. There can be a range of symptoms, from very mild to severe. Some people may not develop symptoms. Common symptoms include fever, fatigue, and respiratory symptoms such as cough, sore throat, and shortness of breath. Some people reported loss of their sense of taste or smell, and some may develop a skin rash. In more severe cases, there could be pneumonia, organ failure, and sometimes death. About 80% of cases recover from the disease without needing special treatment. But there are some people who are at risk of serious illness. They include older people or people with underlying medical problems, such as chronic respiratory disease, obesity, diabetes, high blood pressure, heart disease, or cancer. How can we tell whether someone is infected? The infection is commonly diagnosed by a test called reverse transcriptase polymerase chain reaction, generally known as PCR. This test identifies the virus based on its genetic fingerprint. There's also a blood test that can check for antibodies against the virus, which may show that someone was infected in the past. How is it treated? The treatment for COVID-19 is mainly supportive care. Medicines against the virus are currently under investigation. How do we prevent transmission of the virus? There are a number of effective ways to prevent the spread of the disease. These include covering your mouth and nose when coughing or sneezing with a flexed elbow or tissue, and throwing the tissue in a closed bin immediately after use. Wash hands regularly with soap and water or an alcohol-based hand rub, maintaining at least 1 meter distance from people, and the appropriate use of masks and personal protective equipment, especially in health settings. It's important to stay home if you're feeling unwell and to call a hotline or your medical professional. But if you have a fever, cough, or difficulty breathing, seek medical care early and share your travel history or contact with someone unwell with your healthcare provider. In some areas, governments have implemented specific physical and social distancing measures to prevent the spread of the outbreak. It's important to follow their advice. Vaccines to prevent COVID-19 are currently under development, and scientists around the world are working hard to make this happen. That's a quick look at this emerging infectious disease. We're still learning about this virus every day, and what's known may change. So please, check the website below for the most up-to-date information.
All right, so that's your COVID-19 video. All right, so there's plenty of resources out there for you to understand how to protect your workplace. And that's why I also suggest actually, okay, either you go to osha.gov and you can search, but actually you can go to Cal OSHA. Just go to, I'll just do like, you can just even Google Cal OSHA COVID, yeah, guidance. I think there it showed up. Okay, let's see, Cal OSHA guidance for yeah, logistics industry or the companies. There. Yeah, see, then you this is an ad for California.gov, so I'm not sure. There you go. Yeah, see, that's the logo. See that Cal OSHA logo right there? That's the logo for Cal OSHA. And that's also, that logo will also be on their IDs when they show up to your door, if they ever show up to your door. Yeah, look at this, it's pretty comprehensive. I mean, I just did one search, one try, one hit. And this was October 27, 2020. So I mean, usually they'll release something brand new, you know, and that'll be a newer date. But I mean, at least this is the most recent guidance that you can implement on the job You know, and then, hey, you know this when you come on the job, you look real smart because now you know how to do these kinds of, you know, you bring value to the company, especially when you can say, hey, no, I understand Cal OSHA guidelines for COVID-19 for protection of employees while they're on the job. You know, just when you're doing interviews, try to find ways to, you know, include things like that in there. Okay. Update the IPP to include information on employee training and preventing the spread of COVID-19 in the workplace. See, there you go. This is mandatory in most California workplaces since COVID-19 is widespread in the community. The logistics industry includes warehousing, ports, trucking, and delivery services. There you go. You know what I could do with this one, right? Is I'm going to save it to my just to my stuff right here. Oops, this one. When I find something, so what I can do is, and well, here's I can do the next step too. So what I do is I add it here. It's a resource for now for my class. Boom. COVID-19 infection prevention. Yep. It's just it's stuff that's useful. You know what I mean? That I'll keep on adding to this. So again, once you're out of the program, I don't close off access. This is open. You can't necessarily like change anything, but you can always go in there and take a look and all that, right? So that's for your resource right there. You can even probably, you know, if you do a training on at your company, I mean, if you want to download the PowerPoint, you already got them right there. Just use it. And if you need me to help you, even give you some tips on how to go about your training, right? I wouldn't mind helping out with that, you know? Yeah, reach out to me, right? So I want to share that with you guys. All right. So moving on. Other bloodborne, we talked about Zika and Ebola. That's how they look. Most are rare in the US, right? So, I mean, you have to probably just deal with it. I mean, so that's why you want to be really good about, let's say, in the hiring process, for example, right? And especially if you like, you know, you want to hire somebody, that you're finding out if they've like left the country, you know, especially, oh, have you had any travel, like international travel? You know, that way you kind of, if you're really concerned about individuals that may have any kind of rare disease from other countries, then you can at least figure out if they were outside the country, and that's your cue, you know, to at least maybe provide some more information or request for more information, things like that. Okay. So bloodborne pathogen examples. These are the different types. Other bloodborne pathogens. I don't know if you have had any experience with any of these, but some of these are pretty much rare. Now, the only thing about arboviral infections, pretty much if you've ever been affected by plants, arboviral. So like poison ivy, poison oak, things like that. So now let's talk about biohazardous sources of contamination, blood or OPIM. So OPIM stands for other potentially infectious materials. So any human bodily fluid, I won't describe any of them for you. You can just imagine, right? Those are considered other potentially infectious materials. Anything that can come from the human, like saliva, right? Urine, those potentially can carry bloodborne pathogens, right? That's why we wear clothes. All right. Plus, we don't want to see everybody that way anyway, right? So any unfixed tissue, culture mediums or other solutions that have potential chances of transmission, right? So when you talk about culture and culture mediums, they're talking about bacteria. Sometimes corporate culture can be a bacteria, disease, sometimes. And then you have experimental animal blood, tissue organ, It says infected with HIV or HPV. So some, this is like lab stuff. So we're not worried about that too much. But how does it happen though? What is the risk of exposure? Okay. So it could happen by direct contact, right? Let's say I have my hand and then I touch you with it. That's direct. Like if I cough in my hand and I try to shake your hand, you're probably like, I don't know if I want to shake your hand. Maybe you hold your hand back a little bit, right? That's like, you don't want to direct contact anybody's cough, right? Indirect contact would be something like touching a light switch that has been previously touched by another person who's got a bloodborne pathogen on them. Respiratory transmission is pretty much anything that's aerosol related for sure. And we talk about the word aerosol, it's just little, it's small enough, I guess, not droplets, because droplets are described as something that will drop, right? They'll fall down to the ground. That's why we had the 6 foot rule, right? The 6 feet social distancing, physical distancing, right? Because droplets tend to travel that far. Like when you ever had to tell somebody, say it, don't spray it, right? Well, usually their saliva will travel under 6 feet. Those are droplets, right? When you say it, don't spray it, those are droplets. When you sneeze or cough, sometimes you release what's called aerosols. Aerosols are tiny, they float in the air. They're small enough that they don't fall to the ground. And those are the ones that are most dangerous when you're in a room that has poor ventilation, right? Because imagine someone like spewing out a lot of aerosols and they're actually sick, right? It's going to accumulate in a certain part of the room. And if you walk through that part of the room that has all of these aerosols, you just got yourself respiratory transmission, right? That is what's considered respiratory transmission. So, and then you have vector-borne. Vector-borne is basically flies, ticks, mosquitoes, and whatever else you could think of that's gonna come at you, right? Vector-borne. Those are the different ways of exposure. So how are you thinking about this? Well, is there a risk of exposure for any of these types in your workplace? All right, so, and then how do exposures occur? So needle sticks can be a form of exposure. Cuts from other contaminated sharps or any contact with any mucous membrane or broken skin with contaminated blood or OPIM. Okay, so for the most part, if you're working like in a lab, labs are very high risk, right? Because if you're working with blood and all this, and someone just happens to spill blood all over the place, that's pretty horrible, right? So those are your risk of exposure. Now, who is at risk of exposure, right? Like which workers? Well, first responders are definitely highest risk, right? If you're dealing with people and you have to touch them or be in the area that you're, that they're breathing too, right? Housekeeping personnel in some industries, and usually in the jails, those are probably the ones where housekeeping are very at risk, right? I'm not sure how that works. I'm sure they have the inmates clean their own cells, but I'm sure they have like professional cleaning at some point to do inspections and whatnot. But those, I would imagine those people are, they're fully geared, but they're still at risk. Nurses and healthcare personnel, for sure, right? For sure, you get all kinds of people at the hospital. So that's a very big exposure risk. That's why I recommend if you are, if you feel like you're going to be in a group of people, like a lot, like, especially for logistics, supply chain, or if you're working in an office with a lot of people, I highly recommend you guys look into taking cold showers as part of your regimen, your daily regimen. Cold showers are great. I mean, you might think, oh my gosh, cold showers. Yeah, I take my cold showers at 10 p.m. before I go to sleep. I wake up refreshed, but it took some time. So, but what kind of benefits does the most obvious benefits that cold showers can bring to you, right? Is your immune system getting a boost. Look at read on it. Read cold. What are the health benefits of cold showers, right? You can say more broadly, do a search, right? Or you can even say, I mean, if you want to look more specifically, how does cold showers give you a better immune system, right? Like that. You can put it that way. Because if you want, but that for some people that may be too specific, and you're definitely going to get results that are that may be biased, right? That's probably what's what the downside is if you do a more targeted search. You get more biased articles and whatnot. But if you just do in general, what are the health benefits of cold showers, then you can see. But yeah, it's great. And if you want to protect yourself, and this is where I'm not an anti-vax. I did take the COVID vaccine, but I don't usually go for the flu vaccines. I don't. The last times I took the flu vaccine in 2012 and 2013, both 2 years, and both years I got really sick, like from taking the vaccine. Like I for some reason I took the vaccine, and then I don't know, like 2 weeks later, I got two different strains of the flu of the flu virus that where the vaccine didn't even work at all. I mean, it seemed, and in the second year, it happened again, right? Twice. So I don't know. I don't think there was a coincidence there. So I took it upon myself, read up on cold showers, and I started doing them back in 2014. It was probably like 2015 or so, around that time, 2014, 15. But it's not easy. Trust me, when you start doing cold showers, it's gonna be hard. There were mornings I sat for 5 minutes just psyching myself out. Like, am I gonna turn this water on or not? Like I gotta get going. Like, so there in the beginning it's not that easy, but once you get going with it, like today, like nowadays, right? 10 o'clock, 10 p.m., no problem. I kick the cold shower on all the way. I stay in the water now. Before I couldn't stay in the water. Now I can't. Now I can actually like stay in the water for more than like a minute. Before I like, oh my gosh, it's really cold, right? But your body does get used to it. And I do feel and I'll tell you this last little tidbit about it, and I'll move on, right? My kids, I have 3 kids, and guess what happens, right? They get sick. They get plenty sick. Even with the flu vaccine, I guess they're less. They don't get as sick as bad, right? So, but I know they get sick because there's days where they have to stay home from school because they have a fever, whatever. And I know there's times I get their viruses too, right? But what happens the next day? I wake up fine. Like I don't even, the onset is like gone the following day. My rest, my sleeping helps my body recover so well that I don't even, when I wake up, I don't feel any of the, if I feel a scratchiness in my throat, or if I feel a kind of like my head, you feel like your head weighed down a little bit because you start feeling a fever come in. I felt that, but the following day it's gone. Like, and that's why I know it works. That's why I know it works. I tell you, you want a good, a way to be more healthy when it comes to diseases. Cold showers. Long talk on cold showers. I'm a big believer, right? So I wanted to share that. So, all right. So if you know nurses, right? Let me backtrack. If you know any Filipinos, chances are they've already been exposed to COVID-19 because 80% of them are nurses. Yeah, that's not an exaggeration, right? I mean, maybe a little bit, but there are a lot of Filipino nurses, males and females, right? But that's what we do. That's what I'm one of the 20 other percent that aren't nurses, mainly because I think my genetics are Chinese and not Filipino. I'm more business minded, actually. It's kind of weird, but yeah. So the CDC estimates that 5.6 million workers in healthcare are now exposed or at risk. That number has grown, right? COVID has just skewed those numbers so much so, right? And then all occupational exposure to blood, to blood or OPIM, like that's the risk. If you have to deal with anything blood or OPIM related, then you may not be dealing with blood, but you're dealing with like drug testing facilities, those are medical facilities anyway, most of the time. But if you're dealing with that, then yeah, you're at risk. So let's take a look at where the exposures happen, or who is at risk, right? So this one is called occupational groups of healthcare personnel exposed to blood and bodily fluids. And that's a time range right there. So, these numbers don't really change that much, but you can see where nurses are the biggest value right there, largest value. And then physicians, right? And then you have your technicians. Those are your top three. They take up pretty much more than 75% of this pie. And then when you talk about where they happen, this is the next section right here, where the exposures happen, then what you're seeing here is inpatient makes sense, right? The longer you have contact time with an individual that's exposed to a disease, is the higher likelihood that you'll catch it too. But of course, when you have proper protection, right? When you use the proper protection, then yeah, you're guarding yourself, from the dangers. But again, that's why you have to practice really, really good systems in order for people to maintain that level of protection. Okay. All right. So let's talk about an exposure control plan, because if you are dealing with a lot of blood, like a lab, hospital, maybe a plant that takes, if I've never worked for a American Red Cross blood bank, but I would imagine they would need an exposure control plan, right? Because they're dealing with blood. So you have to determine what is an exposure at your workplace, right? You have to, is the exposure from, blood, or is it from something else? What is that exposure, and how could it happen, right? So transporting OPIM from receiving area to processing area, well, there's an exposure potential right there, right? Schedule and method of implementation. So when your exposure plan, when there's any changes, right, there probably will be changes, some of the times. So you schedule and implement a method of implementation. You put that process into your exposure control plan, because you're also, what you're doing there is you're actually, you're laying out the scenario, right? So you're also looking to see where any process can be vulnerable to exposure, and you also make sure that you talk about it, and then you have ways to protect. You think about just an exposure control plan, right? When you really, tell you what, right? There's a lot of resources out there online. You could probably get an exposure control plan template for the medical field, right? Do those searches, right? Use Google to, or a search engine. Google is probably the most comprehensive, I would say, and the most used. Therefore, it's probably the most, you get the most from Google, because it is the most used one, right? So, but you want to understand your procedure for evaluation of exposure incidents. So you also want to include your methods for your procedures of evaluating exposure incidents, right? So all of that part of your exposure control plan. So here's how you look at exposure management as a process. Okay, so the first things you always do when it comes to any workplace, right, is you always do a really good hazard assessment, right? Always, right? And you use your hazard criteria, and then you determine, you do a risk assessment from there. So if you determine what the hazards are first, next you determine what is the most riskiest, what is the one that's probably going to happen more than the others. right? And then from there, use your hierarchy of controls to protect the workers as best as possible. And then you run the program, right? When you run the program, then you let it, you see people working, you're going, okay, oh, is there a part of the process that we're missing maybe? No, okay. If there is, then we got to identify it, add a step, like modify, right? Reevaluate as needed. And then you do it again. You reassess the hazard again and see, okay, then, well, did we mitigate potential vulnerability, especially when we're dealing with blood-borne pathogens, OPIM, blood in general, right? So that's you use this as your guide to remind you of how to think about solving your problems or solving the issues, right? So this is called an ERAM model, or the fundamental elements of industrial hygiene, right? And you use anticipation and recognition of, again, the hazards, and then you evaluate the hazards, and then you control and confirm that you've actually successfully contained it or protected people from the hazards. Okay, so the exposure control plan must be available to all employees, because that's you need to make sure that anybody has access to it. So it doesn't matter if it's contractors, then you have to have it in an area where it can be accessible to everyone. And it must be reviewed and updated annually, at the very least, or when there are any new or modified task procedures when they're implemented. That's why you need to also include a schedule of implementation, especially when you have certain processes that you've already done before, and then you stop doing them, and then you do them again later, right? So you already have the process in your exposure control plan. All right, so standard precaution or universal precaution means the same thing, treating all blood and bodily fluids as if they are contaminated. And then you must do a proper cleanup and decontamination. Now, when there's decontamination of anything that could be dangerous, right? When you hear the word decontamination and you're dealing with blood-borne pathogens, you need to designate an authorized person to do decontamination, and don't let just anybody do it, because there are certain steps of proper decontamination to make sure that if something could have any type of a virus on it, that it is actually properly contained, right? So, or in this case, decontaminated, okay? So with engineering and work practice controls, so engineering and admin controls, you're always looking for safer medical devices to use, right? And also, you want to be able to give people the ability to feel safe, even if there's going to be individuals that are going to be needing to give themselves injection shots, people like EpiPen, insulin, right? There's all these different types of shots that people have to take for themselves. And so you need a sharp disposal container available at your work sites, right? If you ever remember going to a buffet or the casino or anything like that, you'll probably see those little boxes that are clear inside the bathroom, right? And then they have a sharps disposal thing on it, right? That's for that purpose. That's for those individuals, and they're there. What are they there for? Well, they're there to protect from people that want to, one, could be reusing those needles, kind of gross, right? Or protecting people just from the fact that they can hurt themselves, cut themselves with the sharp, type of a injection piece, right? And you also want to make sure that at the workplace, you provide areas where you can really take good control of your hand hygiene. Wash stations, especially when there's a lot of employees. Hopefully your office has a break room that has a sink in it aside the bathroom, the sinks, right, and all that. But it's good to make sure that you're always maintaining your hand hygiene, especially with COVID nowadays, right? You got to keep reminding people they need to wash their hands, before they touch their mouth and their eyes and their ears. That is probably one of the easiest ways to get sick, right? Yeah, there may be nothing on your fingers and your hands now, but why take the chance, right? You have to touch your eyes, do your nosy thing, right? You have to pick something out of your mouth or put your fingers in your ears. Just the ear is probably the least exposed as far as that's concerned for hand hygiene, right? But I mean, everything else is pretty much open, right? Once it gets in your eyes, you can get right back in there. So here's your PPE examples. Won't really go over that one, just so you understand the list. So now let's talk about controlling exposures with employers' responsibilities. So we always talk about hazard assessment being an employer responsibility. That's through and through. It's always the parent's job to make sure that the kids are safe, right? Right. So that's think of it like that. If you really just make that connection already, that the managers are like parents, and sometimes you really do have to babysit people, right? Not sometimes, but that's, if you already adopt that mentality that, okay, look, yeah, I gotta just take care of my people, I think you'll be in better company. So employer has to identify and provide appropriate PPE. So when the employer has to do hazard assessment, then that means they have to identify what PPE they need to use to protect the people and then provide it to them at no cost. So that's anything from, goggles, face shields, gloves, face masks and all that. Whatever that PPE is, that you cannot pass that cost on to an employee. So you want to train them on proper use and care, right? It only makes sense. If you don't want your people to be wasteful and just throw away, a face mask after a use of 20 seconds or whatever, when it could be longer than that, then better train them properly, make them accountable for it. So that way they're liable. So when there's some yuck idiot that's always going through all the supplies, wasting it, right? Then you can take them out of the picture because you've already told them that they need to be more careful about not wasting PPE, right? And then maintain, replace the PPE. Employer has to do that. So guess what? You're also having to train the employees on how to identify when PPE needs to be maintained or replaced, right? And then employers must review, update, and evaluate the PPE program to make sure that it's still effective, it still protects people, and it's still keeping the company within their budgets, right? But probably in that order, right? More in that order than the other way around, right? You don't want to be based on your budgets first and then the safety of the people. That's kind of like, well, we can only afford this much safety for our people, right? That's kind of I don't know, that's a good feeling. All right, so PPE selection. Employers have this duty to make sure that they pick a safe design and construction that fits comfortably. Got to remember about PPE, it cannot disrupt any other PPE that's already on your face, right? So meaning to say, like they can't touch each other. They shouldn't. All right. And PPE training, when is it necessary? So in the PPE training, you're training the people on when you need PPE, what kind is needed at the time that you're doing your work, proper donning, adjusting, wearing, doffing, and what are the limitations? Anybody know what the word donning and doffing means?
Donning and mask is like when you probably put it on, but you have to clear like the air inside first to get new air in, right? Donning, because when we in our unit, when we don like our gas masks,
yeah, we
have to put them on, and there's a procedure where you have to release all the air from the inside first by blowing into it as you hold like the canisters, and then you have to suck or breathe in through like the middle portion of the mask.
Donning, right? Simply, if you remove the D, what do you get? You get onning and offing. So that's really what it means. You take it, you put it on,
Okay. Yeah, you put it on and then you don your
Doffing
mask
is
and
taking it off. Yeah. So yeah,
Okay.
this is just what it means. Donning and doffing is just putting it on and taking it off. There's probably other steps that you're describing, right? So that's part of your doffing, your donning process, right? So there's a donning process, and then you have to do that with the other stuff. And you
yeah,
can-
putting it on is like the first step of the donning process.
Yep. And then there's also within the training, you have to train people on the limitations of the PPE, what they can and can't do with it, right? And then of course, the last level there is proper care of the PPE, maintenance and useful life, also the disposal intervals for the PPE. Okay, so that's part of that's the training that needs to be provided. Also, the responsibilities of the employee now is they must properly wear PPE, attend the training that's provided by the employer, care for, clean, and maintain. So they have to be, employees, it's kind of unfortunate to say, but they won't do something unless you tell them to do it. That's pretty much how employees think, right? Because if you're no longer an employee and you're a manager or a supervisor, at some point, someone thought that you know how to think for yourself and act accordingly, right? Be proactive. That's why you became a manager. So that's why employee response. So per OSHA, they don't assume. Remember, OSHA is like, well, we're just gonna state it because we know people need to know this, right? So that's why they say, well, properly wear, attend the training, care for, clean, and then notify when repairs or replacement are needed. But remember also, well, even though OSHA says it, your staff members aren't going to read OSHA either. So it's up to the employer to really tell the people too, how they want their people to behave when it comes to the employee's responsibilities, right? So you have to set the expectations. All right, so housekeeping must be done on a regular basis. And when you're when you're doing any decontamination, it must be done when there aren't people around to inhale all the chemicals that you're using, right? It's decontamination. Sometimes you may need to. When you're dealing with broken glass, you never want to pick it up with your hands, okay? Never, ever, ever pick it up with your hands, right? The best way is a dustpan and a broom, right? That's probably the best way. And then make sure that the dustpan, is brought to an area where the shards of glass can't be, it won't fall down to like a lower level or something like that, right? So, but also remember that I would highly advise against vacuuming glass because of the fact that you could actually kick up the shards and it could hurt somebody. So I don't think it's a good idea. Okay, so proper cleanup and decontamination. Right, so what I would do before I wear the gloves, I would wash my hands first. That one's probably something that I just make sure I do. Before I put on the gloves, I would wash my hands really good, right? And when I put the gloves on, and then use the proper disinfectant, use the clean up the supplies in the area, and then wash up after. Or actually, I would throw everything away first and then wash up after. I think it's better to throw the stuff away first and then wash after that, because if you're washing up and then throwing the PPE away, the contaminated stuff away, unless it was put into a bag prior to that, like you stuffed it into a separate bag that you closed up, then you can wash your hands, right? But either way, if you're already got everything together and you're about ready to throw it into a biohazard container disposal, right? Then you just do that first. Remove the gloves, throw it in there too, and then go wash your hands. It really depends. And again, like you may have to design or write a process that way people know what to follow, right? For regulated waste disposal, right, you must dispose of them in closable, leak-proof red or biohazard labels or containers. Right, red is reserved for blood-borne pathogens, blood, things that could be biohazardous and dangerous, right? So if you're throwing away contaminated sharps, make sure that they're in a closable, puncture, leak-proof, red or clear container. That way it can be seen clearly that there's sharps inside of that box and you shouldn't be messing with it. Okay. And so if you ever notice about laundry is never taken out of a room by hand. It's usually rolled out into a cart. Training, who needs it? All employees that are exposed to OPIM or any employee that's trained to give first aid CPR. Right, so that's you need that. You definitely need that kind of training if you're going to be a first aid CPR person. It must be provided. Employers have to provide it at no cost, and it must be during work hours. Okay. Next one here, Hep B is there's a vaccination for it, and if you don't want to take it, you have to sign a declination form. It's kind of funny now, not funny, but for COVID-19 and some employers that require people to be vaccinated, you have to come into, you have to meet with a notary, have them notarize your signature on this form now to say that you're not going to take a COVID vaccine for, just not going to do it. But you have to sign something you have to sign a notarized document now. That's how serious it's gotten. These forms before, all you need is to take your signature in front of the HR people, and that's fine. But now it's gotten so politicized that you have to do the whole notary thing. All right, so crazy stuff. All right, we're almost done here. No vaccinations for those two. Exposure incident is actually what's considered an actual event that exposes a person to potential bloodborne pathogens. Okay, so that's an exposure incident. With your exposure incident, what is the first step to do? What do you do first? You have to make sure to tell the person to wash the area exposed with soap and water. Okay, or nose, mouth, skin with water, or the eyes if it's got in the eyes. That's the first step. Immediate action. What's your immediate action? Wash the area immediately, right? And then you report your exposure to a manager. Okay, and then once you report that exposure, you direct the employee for treatment. Okay, so and then afterward, there's a follow-up, right? You do everything from contact tracing, maybe some counseling, right? Evaluation to make sure that maybe some blood exams, like a blood test to make sure that they don't have it, right? So those are all done confidentially. Okay, so we'll take a break right now after this knowledge check. We have a good amount of questions here. So bloodborne pathogens can be transmitted by what method?
All of them.
Okay, good. All of the above. All right. Perfect. Good job. Employees should use PPE when? This one's a series of good jobs.
All of them again.
Also good. Which of the following is an example of a work practice control? Now, if you read that again, work practice control, right, is something of where someone's got to do something. So what is the option here where someone's got to do something?
C.
C is right. Good job. Proper decontamination spill areas. Okay, which of the following is a standard precaution for workers exposed to bloodborne pathogens? Think universal precaution here.
Would it be B?
Yes, so treat all blood and bodily fluids as if they are infected. Yep. Good job. So Hep B is an inflammation of which body organ? Anybody else there? Chris is gonna answer all of them. That's good. Got it, Chris? I saw you.
It's A. Is it A? Right?
No, it's for
No,
so
it's
Hep
D,
B
D.
is
D.
the liver. Yep,
D.
correct. In an event of an exposure incident, which of the following actions should be taken first? Remember, what's the immediate action?
B.
Yep, B is right. Wash your area thoroughly. Good. Which of the following actions can help prevent exposure to bloodborne pathogens?
D.
All the above. Good. And vaccine is only available for which of the following major bloodborne pathogen viruses?
B.
B also. Yep. Hep B. Okay. And then which of the following are potential routes of entry for bloodborne pathogens?
It's either I think A. D.
Yeah, it's D. All the above. Yep. All right. So perfect. We're done with bloodborne pathogens. All right. So let's take ourselves a break. It's 10:32. So we can come back at 10:42, or I'll make it 10:40. You know what we'll do? We'll just do 10:45. Give you a few more minutes there.
Do you know what time is gonna be our lunch today? Around
Should be, I mean, should be closer to 12. Do you need to be out by a certain time? Like if you need to leave before 12, like that's, I mean, what's your,
I
what
was
time is-
I was it's for 11.
oh, then yeah, just,
Yeah, 11 at 12, and then if lunch is at 12, you know, that can be
oh, I
good.
see what you're saying.
Yeah,
Well,
before that.
I don't know if, I mean, you just pop back in when you can, I guess, you know, it's
Okay,
12,
thank you.
12:30. I mean, it's only half an hour lunch anyway, so
Yeah. Thank you so much.
yeah, it's cool. Yeah, if you're back and if you drop out, then come back in when you can. Play some videos. I'll do that. Guess isn't it? No, huh? This is Cisa. There you go. Oh, come on. I really signed in. No, this is one. Everybody's on my end. It's 3, and then here now. Yeah, I know that. Tell your yeah.
They can take the test without.
I told him if they're.
Yeah, that's fine.
Oh, and I told him too also that I'm bringing bagels in the morning, so
Okay.
we could probably inform people that
Thank
too.
you.
Okay, so let's. That was actually perfect. The video ended at 10:45. So, all right. We're at safety and health programs, and what this section is the Fed version of the IIPP for the state of California. Okay, so what we're going to be going over here is, well, the objectives is we're going to look at the costs of workplace accidents, like recognize what are those costs. We kind of covered them a little bit. We'll go over a little more. What are the benefits of implementing an effective safety and health program? what are 3 methods to prevent workplace hazards? Actually, that's just a section that we'll cover. We'll cover that too. Okay, so look at this chart here. Fatal occupational injuries by major event 2015. So if you look at what is the most, we're looking at roadway incidents altogether, make up the biggest number of all of them, right? But when you add transportation as a whole, then you get 2054, right? So anything transportation related could be, for instance, driving your big rig truck through the yard, and then getting in an accident somehow and dying, right? Those are some of the examples of that. Fall, slips, and trips, we can see, right? Falling to a lower level is the majority of deaths, and some of them you just fall at the same level for a total of 800. Contact with objects and equipment. So this is anything that's probably within the warehouse itself or the business, and whether you get objects and equipment. So forklifts that you get crushed by a forklift or whatever, it would fall in this category. Violence and other injuries by persons or animals. Okay, so you can say 417 persons, 286 animals, pretty much. I mean, unless there was an accidental death by a person here in this area here, so that's possible too. I would ponder that, there's probably less animals and more accidental death by another person here, right? That's what I think. I'm not sure. Exposure to harmful substances and environments. Okay, so this is important, but knowing this number means that you also know that if people are in certain type of exposed to certain gases, maybe heat, physical, then it would fall in this category. And then the last one here for 2015 is fires and explosions, which is only 121. Now, that's still a lot, 121, but I'm also equally as relieved that it's not more. That's not more, right? So it's like, these are your fatal accidents or fatal incidents on the job. So we're looking at that. All right. Now, so what are the cost of accidents? So remember, we were talking about this in another module briefly, but when we talk about an OSHA, when you talk about OSHA direct costs of an accident, then think about the person itself experiencing these costs. Yes, you might be covered by your employer's workman's comp insurance, right? And you'll probably not have to pay anything out of pocket, right? But also imagine that, again, direct cost just pertains to the individual. So the cost of treatment to yourself, what does that cost? What is the cost of a physician in the hospital? How about your medications, right? And then the cost of medical equipment if you need anything outside of the hospital, right? Sometimes, you need a BPAP, right? If you know what that is, right? If you have sleep apnea, which I used to have when I was overweight, right? I needed a BPAP so I could sleep properly and get the full night's rest, versus if I didn't, then I'd be tired all the day, but I would like nod off. And I can't tell you how many times I've actually like nodded off driving on the freeway, when I was overweight. So the cost of medical equipment, right? Now, indirect cost would be related to the company. Okay, so just know when we talk about cost of accidents, right? Direct cost, person, indirect cost, company. Okay, so what does the company experience in cost, right? Well, schedule delays. Think about that, right? You lost a person on the line. Now you have lower morale, right? So lower morale in the sense that your people are now, they know that they lost a person. Either one, they're picking up that person's slack, or they're lower morale because one of their friends got hurt, right? Or both. And then this person that got hurt will have increased absenteeism because when they get back, what's going to happen, right? Well, they're going to have to go to more therapy, perhaps. They may need to do less of the work they're doing because they have to do light duty or whatever, right? And then that all translates into poor customer relations. Now you have orders getting backed up that was supposed to be available by this date. Now they're not going to be available for another week or so, or a few days even, right? Then that's going to cause poor customer relations. And then all in all, when someone gets hurt, well, guess what? You have to provide training. So you have to retrain some people because they got hurt, right? So those are your indirect costs. Now another way to look at direct costs and indirect costs would be, what are some out-of-pocket costs, right? Like what's something that you have to actually physically pay money for, right? And then what are some indirect costs where you don't necessarily experience them costing a singular amount. It's more of a it's a cost that will affect the bottom line indirectly, right? It affects the bottom line indirectly. So that's kind of how you want to look at that. But the easier way to look at it is pertains to you, pertains to the company. I think that's what indirect and direct costs are also described as. Okay, so what are the pros and cons of a safety and health program? Well, we all know the pros. The pros, you get improvements in product, process, and service quality. That's why you want a really effective safety and health program. So imagine that, remember that the layers I drew here, right? You cover layer 1 for yourself, right? And your people understand that layer, that it's covered. Then remember how, if you saw that video of how good leaders make you feel safe, well, if you saw that video, then you'll also know that how good leaders make you feel safe. When they make you feel safe, then you're also free to put in your best work. You're free to just give it your all, and also that you're more inclined to work your hardest, right? You feel like the company's got your back. You feel like you're going to work hard for the company. It goes back and forth. But if the parents make the kids feel like they're well protected, they have a good life where they have food in the fridge, they have clothes on their back, and they're living their best life, learning about growing up and things like that. Then I think that some children feel this like, hey, cool, I have all these bases covered, and therefore I can reach higher, reach more, and do more, right? So that's real. That really does happen in the workplace too, which turns out to be better morale because people will be happier when they come to work. If people like seeing each other at work, like I think if you did in doing a lot of surveys, I did them myself personally. Plus, I also was able to account for some like numbers from a company, right? I always felt like, and from what I saw also, was that a person is more likely to like coming to work because of the people they work with, right? And that's a lot of times it's a good indicator of your culture. Less often a worker likes coming to work because they like the management, right? It's usually because of the coworkers. So, but if you think about it, right? If you have, people will come to work and are going to look forward to meeting their coworkers. So if they don't look forward to meeting their coworkers because there's a strict competition between your coworkers and yourself, then you're probably less inclined to want to come to work, right? So your morale is lower. So when you have a good safety and health program, I'm tying this all together, right? When you have a good safety and health program that makes sure that workers are being accountable and being safe, right? Then when you come to work, then you take care of that, and then you're happy to see the people you work with. Well, then you're more inclined to be more productive, right? So when you're happier on the job, right? When you like coming to work, that's improved retention. You'll work longer, right? You'll work longer with the company, not necessarily like work longer hours. You'll work longer with the company. You'll stay longer, right? And then it's also a good recruiting tool, because if you stayed there a while and then you know that the company is a good company to work for, guess what you're doing, right? Hey, you're telling people, hey, look, we got an opening right now, and I know your experience. You should probably apply. Now you're recruiting for your company, right? Which all in all creates a more favorable image reputation. So when your company has a solid safety and health program, it attracts better people to your company, right? So that's another thing that employers don't realize, really. And when you get what you pay for, right? If you always lowball people and try to pay them kind of cheap, then guess what? You're going to get cheap people, right? Here's my belief, and then take this for what it's worth, guys. And this is actually what I've seen throughout the time too, right? You don't attract what you want. Okay, you don't attract what you want. You attract only who you are. Okay, let me say that again. You don't attract what you want. You can want all these things in your life, but you can only attract who you are, right? You can only, so if you're, in life, like people that you surround yourself with, you're attracting people like you, pretty much. So if you're a certain way, and you know how you are, you know how you truly are deep down inside, you're probably attracting people just like you. And if there's something about you don't like, then you better figure out what that is and then improve it, change it, right? Replace it with something. And then that way you can attract people just like that, right? That's if you want better managers, right, then be better followers, right? All right, so let's talk about this. Management leadership is our first slice of this pie. So now let me dig in a little bit further. I'm gonna zoom in right here and show you the sections. So in the IIPP, remember there was 8 sections. Well, they lay this out a little bit differently. And there's 7 sections here, and then some sections are combined. So if you're in California, you're not using this, okay? You're only using this if you're not in California. But if the state themselves have their own OSHA program within the state, then you have to follow that state's program for OSHA, right? And the reason why I'm going through this for you is because it is a federal class and it's a required module. So, but I gave you guys Cal OSHA because you're in California, and it's best to really be exposed to Cal OSHA understanding, right? Okay, so, but we'll go through this because there's a lot of great resources here to be also seen. All right, so first we looked at management leadership, creating a culture of safety, facilitating trust, and reinforces the core elements. Okay, so that's what good management leadership should do. Right, and then we talk about worker participation, hazard investigation and assessment, hazard prevention and control, education and training, and then program evaluation and improvement, as well as multi-employer work sites. And really, we're just looking at this from a level of what's required. Okay. All right, so first one, how do we let people know we're committed to their safety on the job, to our employees? Well, you communicate it by writing a safety and health policy statement signed by top management. Now, this takes a page and literally, like pretty much, right, metaphorically, takes a page from how our Constitution was actually designed or was conceived, right? Because we wrote a Constitution, right, on a paper, and then what do we do at the very bottom of that? Our founding fathers signed it all on the bottom, right? That's why you have this. I don't know if you've ever heard the saying before. May I have your John Hancock, right? They say your signature. May I have your signature? Because what's the biggest signature on the Constitution of the United States, right? It's John Hancock's signature, right? He's the one that put his name on that real big. And that kind of shows you, or that what he wanted to show you there was he's a big supporter of our Constitution, right? So I think you can mirror that at your company by having a policy statement signed by top management and then putting it in your front front entrance where where people come into the building, not necessarily like outside the building, but where there's like the reception area, like the lobby area, put it there where the employees come in the break room area, right? And that's a good place to put it too. And and then not just having a signed document, right, by the top management, where they're actually embodying it, they're living and breathing it, right? They're talking about safety and health as a priority for their people, right? Give you an example. That's an example. Not many places are like that in total. There should be, but we understand the reality. 2, define program goals and expectations. Well, you want to establish realistic, attainable, measurable goals, right? It's pretty key, right? I mean, if you're going to talk about having a successful workplace, you're not going to try to make your people do things that they don't understand how to do, right? So make them set forth realistic and attainable goals, all right? And then develop your safety and health plans accordingly. Then once you've created a plan and set the expectations, then you provide and allocate resources, right? It only makes sense. If you want people to do a good job, you make sure they have the proper tools to do the job, right? Whatever those tools are. They could be physical tools, they could be software resources, right? Or it could be just the availability of a knowledge base, right? Could be that. So, but you want to integrate safety and health into your planning and budgeting, right? That's why, if you're thinking about, when you have to do your budgeting and planning for the year for the company, right? Make sure that safety and health has a say. They have a seat at the table, and they can put in their input and for what, how the workers are working and how we can provide safety or additional safety for better for our workers. And then of course, whenever you bring in do a new type of system or you do a new anything, right? Then you always allow time for workers to schedule in their participation for training. Allocate resources. Okay, and then once you set them all up, right, then you expect performance. And I would even go to find ways to do interval checks to make sure people are progress checks, right? The one thing about people is that if they get stuck somewhere, they don't know what to do, and the culture of the company is like, well, if I ask somebody, I look like an idiot, then they just stop doing it because, one, they're not really getting guidance, and 2, they're waiting for the manager to tell them how to do it right, which is, there's some cultures that are like that. But that's what I'm saying. But that's why you want to communicate responsibilities and authorities for accountability, right? You want to really clearly define the expectations, right? And then of course you want to set an example for your workers by following your same procedures. You really do. I mean, you can't always expect people to do what as you say and not do as you do, right? People at some point, that doesn't really always, I don't want to say it never works, because it does work for some situations, but that it's not as effective. It's not as completely effective in certain situations. So that's why you want to be consistent and set the example for yourself. Okay, so let's talk about worker participation now. Okay, so worker participation. So let me read that little bit of a note there for worker participation, right? Results in better design, implementation, and evaluation. Well, encourage workers to report safety and health concerns. This is a section where you want people to feel like they can raise a concern without feeling like they're throwing somebody under the bus, right? And you don't want managers should not instigate situations, right? Managers shouldn't say, hey, if you want to snitch on people, just let me know, right? I mean, you don't want people, to start. You don't want to create a culture of, wanting to get people in trouble. That's not a good environment to be in, because that's when the environment starts to look like, hey, I gotta defend myself from my other coworkers, and which inherently weakens the organization. It really does. Okay, so, but establish a process to report injuries, near misses, and other safety and health concerns, right? You want to establish a process. So process being what? You want to have a suggestion box, sure. And make sure you call it that and not a snitch box, right? You shouldn't propagate. The manager should not propagate negativity, right? That's propagating negativity. That's like telling, hey, just like you're always encouraging them to snitch on people, right? And you don't want that kind of culture. You want to be able to go, okay, so here's a really good way to find out how to report concerns, right? Because when you ask everybody, that let's say having a meeting, hey, so what are the problems going on right now, right? And that's really a poor question when you ask, especially for a manager to ask, because what's people gonna say? Like, are they really gonna admit there's problems, right? Depends on the culture, but if the culture isn't that way, then when the manager goes, oh yeah, so what are the problems going on right now with our operation? Well, there's no problem, sir. No problems right now, right? But I think the better question to ask, right, is you go, well, if there were to be a problem, what would it look like, right? So what are you doing there? You're removing the premise of an existing problem, right? And what you're doing is you're trying to incorporate problem solving by saying how it would look like versus what it actually looks like, right? Because now you're trying to get people to imagine situations, right? Think of that. Write that one down if you want. That's a good one. That's a good one to keep for a manager. And so if there are any issues or problems, like if there were to be any issues or problems, what would they look like, right? And that's a good way to get people to open up and have a discussion, right? Versus asking what's wrong. So what's the problem right now? What are the problems, right? That's I think leaders need to know how to communicate better. Just like parents need to learn how to communicate better, right? With each other. Like some parents don't communicate with each other, which is not the best way to go. Yeah, and some managers at the workplace, they don't talk to each other either, right? You know what I mean? And then when you give the workers the ability to stop work that they feel is unsafe, and you're not gonna like reprimand them, like, hey, if you don't do that, I'm gonna get someone else to do it and fire you, right? Like that's, until you really listen to what they're concerned about, right? Empowering means not just giving somebody the ability to decide, but I believe empowering is also what it also includes is that you must train or teach the individual how to use that power, right? That's empowerment. It's not just giving somebody the ability, it's teaching them how to use the ability, right? That's empowerment. And then you want to encourage participation in the program by positive reinforcement, right? Formal recognition is great, but how about just verbal recognition? Like, hey man, it's a great job you did right there, right? Just to their faces, right? I mean, if it's to them directly, think about this: serotonin release, status and pride. if I tell you you're doing a good job and then you really were putting in an effort to do a good job, guess what that's going to do for you? Or guess what you're going to want to do going forward? You probably want to, hey, that I did a good job. I'll keep doing that. Like to get the recognition from my boss, right? At least he's telling me I'm doing a good job, right? And then if you tell your kids they're doing a good job, there's going to be a higher likelihood that they're going to continue that behavior because that's positive reinforcement. Okay, remember that. When you release serotonin for somebody, that's like, that feels good. If it feels good, you want more of that. You want more of that good feeling, right? That's how we humans are designed. And then you want to maintain an open door policy. Okay, so you invite your workers to speak to managers about safety and health. And whenever you say open door policy, make it realistic. If somebody comes up to you and they go, hey, I thought you said open door policy, but then you're not going to talk to me right now. Well, maybe you can't because your schedule doesn't permit, right? So you have to be able to go, you know what? My schedule, my time is limited, or if you want to go that route, right? I have an open door policy, but if there's something that we really need to talk about, we're gonna need to schedule it for a time to talk about it, right? So, and make yourself available, right? So that's open door policy. Sometimes it's not realistic to just say open door policy, and then you come up to a boss's door and they're like, oh, you know what? Not right now. I gotta take care of some stuff. Yeah, maybe next time, right? But see, the proactive approach of a manager should be, oh, okay, what's this about? Okay, can we set a time to talk about this? Okay, I'm putting it down in my schedule. Okay, I'll send an email out so that we can both be reminded. That's a good feeling right there. Now you feel like your boss is doing something for you, right? So remember, customers are not just your external customers. You also have what's called internal customers, right? And that's going to be the people that, if you see it that way, it makes a lot of sense. You're providing customer service to your employees, right? So that's a service. Remember, you're a manager because you're knowledgeable, you know how the system works, and you can coach people to do a better job. That's what really a manager should really be able to do, right? To be able to know the work. And when it's nice to have a manager that has moral authority, right? It's nice for a manager to be able to say something like, you know what, I wouldn't ask you to do anything that I don't know how to do or wouldn't do myself, right? That's at least the second part, at least the part that I wouldn't do myself. Sometimes managers don't know what you do, right? Wouldn't that true, right? Sometimes managers don't really know what your job entails. And if a manager can admit that vulnerability to you and be like, you know what, there's parts of their job that I don't understand, right? And I'm going to rely on you for the information. But if you need anything from me, there's a way a manager talks that makes you feel like, yeah, this manager knows, he understands, right? So now let's involve all your workers in aspects of the program as much as possible. Like, for me, I was always the kind of person that wanted to be more involved. I wanted to do something like, I wanted to serve as a trainer, right? I wanted to always be like, what I'm doing right now. This is actually something that I love doing. I love being in front of a classroom, in front of people, sharing knowledge. That was something I had even as a younger individual in my 20s. But as a young one in my 20s, what I didn't realize was I had to show my supervisors, my managers, that I know how to behave like a parent in order for them to give me the opportunity to serve as in a role in a capacity as a supervisor or a manager, right? That's kind of if I had known that mentality had to exist before they would allow me to oversee people, then I probably would have looked at it a little differently, right? But that's the thing. If there's somebody who is inspired, they're motivated, or they're encouraged to step up, right? Give them a chance. And I think if you give somebody a chance and you take away the fear factor of failure, right? Meaning to say, if you tell them, hey, look, even though if you mess up, don't worry about it, okay? It's a good learning experience and you'll do better next time. If you give somebody that confidence that you got their back that way, then guess what? They're not afraid to fail, right? Now they're not going to be, well, there may be less, they'll feel less pressure for failing. Maybe they'll still be afraid to fail. But if you take away that pressure, then as a leader, as a manager, then what you're doing is you're empowering your people. You really are. You're giving them more belief in themselves too. Because you're telling them, hey, look, I know you can do this, but I know you might mess up. But if you do, don't worry about it. Don't worry about it, right? Here's what I say, like when especially in this business that we're in currently, in this nonprofit organization that I'm working with, I do oversee and train people still. So, but I tell them, like if they're making phone calls to general public, like outbound, I always tell them, hey, look, if you're gonna mess it up, just you're gonna mess it up. Just mess it up royally. It's fine. We'll figure it out later. And just tell them, hey, look, don't be afraid to say what you need to say to a person. I'll correct you if I have to at certain points. But yeah, if you make a mistake, then don't feel bad. You're learning. This is what it's all about, right? And people feel more at ease. Like what, the pressure is a little bit down, and they get more in the groove. I think that helps. It helps your people work better, right? So involve your workers in the program. Okay, so give workers access to safety and health information. So this is another important step. If you want people to feel comfortable with what they're doing, then they need to have information that they can process and understand and have readily available, right? So if you're not going to get it for them, then you better make sure to show them how to get it, right? That's part of being a parent, right? Like, your kids, they should know how to do things on their own. And if you keep doing it for them, they're never going to learn, right? So you got to show them how to do certain things. And if you have to show them where to get where to get certain things, right? Then yeah, you should do that until they get it. Same thing with this worker participation of number 4 here. Make sure that, sometimes some numbers are harder to find. So, if you know how to do it, then you better sit down with somebody closely and mentor them. Right? That's, Now, remove barriers to participation. So what do we mean by removing barriers to participation? So make sure that everybody at all levels, even if they have, more education than others, that when you're doing any kind of training, that you do it in a vocabulary and language that people can understand, right? And of course, make sure policies and programs don't discourage, right? Don't discourage your people from participating, right? So you make it an inclusive culture, right? Not an exclusive culture, right? You make sure you include people, right? So don't remove barriers, remove the barriers for people to participate. Make sure that people will get the feeling that you want them there, right? That's the way I would think about it. Now let's talk about hazard identification and assessment. Okay, so if you're not familiar, if you're not too familiar with logistics and supply chain, maybe manufacturing or any kind of so this one here is called emergency room. OSHA actually has what's called a hazard identification training tool. This is a really good tool. Let me show you the website really quickly here. I'll go to the Google search page, and all I would have you type is OSHA hazard identification training tool. So it comes up there already. So it's purple for me because I've already clicked on it before, but look for OSHA.gov has Finder. Okay, and that's the official site. Okay, so once you click there, you're going to see this hazard identification training tool, okay, which has a Windows version or a Mac version. So depending on your computer, what you have at home. This doesn't work on Chromebooks or tablets. You really do need a Windows computer or a Mac piece, computer to use this software. Okay, and let me show you what it does. So okay, yeah, I have it in a different folder here, but I'll show you. So this right here is about a minute. I'm gonna slow it down so you can see it in better detail, and I'll talk through it.
Small business owners use Melio to send and receive basic.
Okay, so let me slow it down to about a half speed. There's no audio in this thing, so here's a beginning screen, right? And when I press play here, it's gonna give you like two options. You can either play as an owner or as a worker, right? There's two different perspectives to understand, right? Worker and owner, and which makes sense because OSHA, in this class, there is an OSHA 10 and an OSHA 30. I'm telling you right now, this workers are only getting 10 hours of safety and health training, whereas supervisors and up to the owner, they need to have 30 hours of training because again, they need to understand all of these elements. Okay, so I'll keep playing. And then, so he's gonna play as an owner. So look, this right here is a beginning part of the game. It tells you that you are the head person of Amalgamated Polyscientific Enterprises, or APE International, right? The company that manufactures parts for next generation hovercrafts. Your goal is to make a profit and ensure that your workers remain safe from day to day. You have 20 weeks to maximize your profit while keeping your workers safe. So you have these color-coded elements there. All right, and so you hit next, and then you start seeing the playing field here, or your warehouse. So here you can click on people, you can click on machines and equipment. You can also click on different elements here, like this gantry crane right here, right? This you can click on certain stamping areas, shearing areas. So this is a manufacturing plant, right? So the goal here, see up top right here, there's a profit number. And then there's a safety climate up here. It's currently all green. And then you have an end week button right here. And then there's a little hazard log right here. You'll see this in a second. I'm gonna play that for you guys. Right. So right here. So you clicked on a person and then there's a talk button. So whenever you do any kind of conversation, it takes steps like over here. And you only have a certain amount of actions to take per day before you have to end the day, right? So it's like a RPG type. It's like a, well, not an RPG, not a. It is kind of like a role playing game because you're playing as an owner, and what you're trying to do here is you're trying to pay close attention to people's safety and health, right? So what you're doing is you're learning about the different elements like this right here, of whatever danger there is, right? And you either have to, so when you do that, and then you go into the hazard log, here it is, right? So here's the hazard log. This pops up. Remember that matrix I showed you guys on the second day of OSHA? So the work order matrix, it gives you two numbers, right? So so I was telling you, OSHA here only goes 1 to 4. So when they say severity, this is the extent. How bad can it get? Exposure, what is the probability that it's going to happen, right? So when you have both high numbers, right? So this 3 times 4 is 12, and 12 is like an orange. So if this is the highest one, then you would want to address that one first. Okay, so in the game, so what's the point of this game? The point of this game is for you to be able to be exposed to all different kinds of hazards that gives you in this scenario how to identify. And then also, which hopefully will give you the ability to be able to at least recognize situations where it is dangerous, whereas before you may not have thought about it, right? So I'll continue the video. So right there, you fixed it, and then it costs money. You fix it again, and then so you keep doing that a few times, and then your safety climate goes up, and then you find hazards, right? And then see, there's like these office files. These are like tells you records, right? So you have a safety climate right there. It tells you the question mark. It shows you. And then this is another part of the game. This one is called what's this one called? This one's for like actual equipment. So this is a different section of the game. But this one tells you how to identify hazards per machine. Right. So what's the hazard right here? Oh, look at that. He almost sliced his finger. And then you have to select what the actual hazards are, and then you click on finish to see if you got it right. And it tells you what you may have missed, because sometimes if you're looking at different hazards, you may have got some of them, but you missed some of them. Right, so that's your, so this is a training tool. It's a great tool to play around with. It's out there, it's free. If you're really trying to expand your knowledge base on how to identify hazards, I would encourage you to play around with the game, right? Just to see what it does, right? So that's the training tool. So let's talk about hazard identification. So that was a video I showed you on how to identify hazards, right? So how should we go about hazard identification when it comes to the Fed OSHA level? Well, first is you collect existing information about the hazards in the workplace. So you can either go to your own files at your workplace, right? Review what you have currently, and you should do that. And then you can also review what's available in the industry. And then you can also find out how many within the industry, what kinds of violations are the most common, or what kind of accidents or incidents, not necessarily violations. The tools that are available for OSHA don't just state how many people got citations, but also you also get numbers for incidence rates in a certain type of industry. So you get accident rates, incidence rates, fatality rates, right? All of those rates that tell you what process or what type of industries are most vulnerable to what kind of incidents. And then after you gather the information, now you inspect the workplace. Take a look at what goes on, workflow, equipment, materials, talk to workers. And then 3, you conduct your incident investigations. So if there's any type of an incident, then you develop a plan to begin investigation immediately after an incident or a near miss. Okay, so you create that. So remember, if there's no process like currently, and you understand that there should be, then you should raise a concern like, hey, we don't have a process for beginning incident investigations right away. Who's in charge of that? And if there isn't anybody, hey, why don't I do it, right? Get your feet wet. And then when you conduct what's called root cause analysis, right? There are many different types of methods for root cause analysis. I included one in the resources here, right? And the useful links. There is going to be what's called the root cause analysis and I got it from LinkedIn. So a root cause analysis methodology, right? Help reduce and stabilize. Actually, this is a specific one for this type of increased machine availability and efficiency. What I wanted you to there, this is the one right here. this is what is root cause analysis? If you just look at this here, this would be a good a good overview. Root cause analyses are important to undertake when your project or product is not what you expected. Root cause analysis aims at improving products or process and quality, and they must be undertaken in a systematic way in order to be effective. The general process for undertaking a root cause analysis is describe the problem your company is looking at. Gather data associated with the problem, right? So that's the first step we did in this one, right? Identify potential causes for the problem. So number 2, identify hazard assessment. Identify which causes you will remove or change in order to prevent repeat problems. Identify solutions that will be effective in preventing repeat problems. Implement changes and then observe changes to ensure that they have efficiency and they have effectively eliminated the problem. So what are the 3 main reasons to perform a root cause analysis, right? So this is just a resource for you for root cause analysis. If you really have no clue what it is or what it does, right, then you can look there. Action 4, identify hazards associated with emergency and non-routine situations, right? So when you talk about emergency, non-routine situations, okay, so you should have already identified hazards in a production situation, right? So a situation where you're doing production, where you're making your stuff, but also you should identify hazards in an emergency situation or a non-routine situation like maintenance or repairs. When you're doing a tabletop exercise, right, what are you doing here? Well, you're getting the group of people that have to respond to a situation like an emergency situation or a hazardous situation. Let's just put it that way, a hazardous situation, and you conduct a tabletop exercise to determine who's going to respond to what, right? So you have a facilitator, they're going to lead the discussion, and they're going to give a scenario, and then they're going to say, well, okay, if this happens, who's going to respond to this? And then the people that know their roles, right? And then they're going to respond with what they're going to do. Okay, so that's a tabletop exercise. So you can also, so when you're doing a tabletop exercise for the hazards, right? Then you go, okay, well, for this type of hazard, who's going to address this hazard? Or what if you have this situation? What are the hazards here, right? And then the people will respond. Okay, so it's action step number 5 is characterizing the nature of identified hazards, determine the controls, prioritize the hazards for control. Okay, so you're making sure that you're not putting things into play, right? Evaluate the hazards, consider the severity or like how bad it can really get, and the likelihood that it will happen. Right, so this is important. Make sure that the greatest risks are assessed first or addressed first. You fix the ones that are going to be causing the most problems first. Right, and what do I mean by the most problems? Well, most problems in hurting people. That's how you want to look at it, right? Address those risks first, where it goes to hurt the most people. And then use temporary or interim control, use temporary control measures to protect your workers until you can find the more permanent solutions to be implemented. Okay, so that's how we accomplish that. Okay, next one. Hazard prevention and control. Any questions so far before I continue? I'll give you a second for anybody that may have had a question at some point. Always feel free, especially if we're at the discussion already, to raise a question. If there's something that is not, you don't understand, then yeah, feel free to ask a question as we're in our discussion. Okay, you can just interrupt me. It's fine. At least it lets me know that you're engaged too, right? And that's always a good feeling for the instructor when people are engaged. And hopefully I do a good enough job to keep you engaged. Okay, so how do we prevent hazards? Okay, so reviewing literature, OSHA standards, knowledge publications, etc. Now, you don't have to have a book like mine, right? But here's what I'll show you with this. If you are working for a company, your company should have this, or if they don't have it, they should probably order one, right? This is the OSHA book, right? This is a really thick. See how thick this book is? It's pretty heavy too, right? So OSHA standards are all in here. And what I can tell you about this book right here is this book was written in blood, right? Why do I say that? Right? Why do I say that this book is written in blood? Right? All this right here are rules that were made, right, to protect workers, because at some point somebody got hurt already or somebody died, right? So that's why I say this book was written in blood, because for us to be able to create the rules, one, someone probably had to go through the fire first and determine, oh, wait, that's not safe, right? We got to make a rule against that, right? And that's how this book was actually made, right? So I would go here first, especially if it's something that's already covered by OSHA, right? Because they probably faced a majority of the issues already. So then maybe they have solutions for it. So don't reinvent the wheel, right? And definitely get input from people. That's probably your best resource is people, right? They are your best resource because they're the ones that do the work. So if they're doing the work, right, and not a machine anyway, right? Sometimes in the future there will be machines, but get their input, figure out what they're saying. What do they think is going to cause problems, right? Identify the options. And then you pick the controls using the hierarchy of controls and using a combination where no one single solution can fully protect the worker. Okay, so remember that OSHA is not like a zero-sum game. It's not like, okay, well, if you do this, then we can't do that. No, you can do as much as you need to protect your workers from the dangers on the job. Now, it's always a question of, are we going to spend the money, right, for this equipment or for the safety tools or whatever the case may be, right? Are we going to spend the money? But the better question to ask is, what's it going to cost if we don't protect our workers, right? And we're caught not protecting our workers, right? What is it? The cost is higher because you'll have all of these things to fix. You have to get citations. You'll have to do abatement. You have to fix everything, and then you have to maybe go to litigation, perhaps, right? So to avoid all that, again, pay now versus pay later. Develop and update your hazard control plan. Okay, so list your hazards in order of priority, right? Make sure you assign a person to complete it, and then give them a target completion date. Right, so that's when you have identified issues that don't just take 1 day or 1 hour to fix. It'll take multiple days, maybe multiple months. Then you want to make sure that you develop that update that plan, and you make sure you make a person responsible for that. And then maybe the person that's in that area or using the area of the machines, maybe that's the person that needs to be assigned to. And of course, plan how to track your progress. That's the one thing that I think a lot of managers really suffer from, right? Is that when they want something done and you're like, okay, I'll do it, but I don't know what I'm doing, kind of thing. And then there's no feedback system from the manager to the employee. Then it's hard to really blame the employee for not doing a good job. I really think, because I mean that's a manager. A manager has to properly assess a person, I believe. 4, select controls and select controls for your emergency and non-routine operations, right? So your same thing here where you're assigning responsibility, right, to a person for conducting drills, but you're also making sure that this person knows how to prevent the hazards when it comes to emergency and non-routine operations, so maintenance and repairs. Action 5, once you implement the selected controls, right, go ahead and run your plan. And then 6 is you confirm it's effective. Okay, so that's your number 6. All right, now let's go to, we got like 2 more sections here after education and training. So as the employer, you are to provide program awareness training. And they're provided to every single individual doing the work. So whether it's actually warehouse work or office work, right? You got to provide awareness training for everybody. Yep. Contractors too, staffing agencies, right? And you want to train them on their rights under the OSH Act. So that the intro slides on day 1, that's something that I would say most companies don't really do, and they should. Train workers on their specific roles and responsibilities in the safety and health program. So make sure that if you're having a worker be available for a certain type of position, that they're trained for it properly, right? So action 3, train workers on the hazard identification and controls. So that's why it's always good to use that hazard identification training tool. And I know it doesn't have all the industries in there, but it has a fairly good amount of content to be able to do anyway. So we got to make sure that you train workers on the controls. Do your job hazard analysis. Remember the JHAs, do those JHAs and train workers on how to read a JHA or create one. And make sure you have the workers demonstrate they can recognize hazards and understand why controls are in place. Like, you ask somebody, okay, so why is this here? Then they should be able to explain, okay, well, yeah, that's there to make sure that my tie downs don't just come off, right? Providing new training on new tasks and equipment or assignments, and make sure that where required by site-specific OSHA standards, HAZCOM, lockout tagout, right, that they're implemented when they're absolutely necessary. All right. Program evaluation and improvement. Always have a mentality that you're seeking to improve. Okay, seeking to improve, because even if your program is running well, you've got people are being safe, right? So you always want to check, verify core elements of the program are fully met and the key processes are in place and implemented. So when you have managers come in to cover different shifts, you got to make sure that they have the same set of tools available to them and that they get the same kind of training across the board. So that way it's not one manager's like, oh, well, hey, I didn't know how to do that kind of thing, right? But verify the program is working, right? The reports are being tracked and submitted, and you make sure that data is being collected too. Action 2, correct program deficiencies, identify opportunities to improve. So you're always wanting to make sure that if you're you're running a program, then you give people all the information, you watch them run it, and then you give them feedback on what's the good things they did, and then what are the areas that they may need improvement in. You got to remember positive reinforcement, right? praise them at first and then offer a critique second, not the other way around. Soften the blow. You gotta soften the blow. Remember that. In life in general, right? Like you don't want to break bad news like right away to your kids. You want to soften the blow, say something positive, right? Or if it's about them, especially if it's about a critique on them, then you always want to soften the blow by saying something positive first, and then you add the critique after that. It's almost like you're candy, like not candy coat. It's like you're sugar coating it almost. Not, and you don't want to put too much sugar on it either, right? You don't want to make it sound so sweet for them that the criticism becomes more like a kind of like, oh, well, why'd you say that, right? Make sure it's kind of balanced. But make sure that you're correcting program deficiencies, identify opportunities to improve. Okay, so always, I like to always proactively seek input from managers, right? So what do I do when I'm the manager? I seek input from my workers, right? I asked them, hey, where do you think, I can improve my area in helping you do your job better, right? Those are some of the managers. You're like, man, this person gets it, right? So you do it both ways. Like as a man, like me as a manager, I seek input from my managers, and I also seek input from my workers. Right, so just look at that. It's good. Now let's talk about multi-employee work sites and some of the requirements. So for management leadership, remember the same copy of the safety and health policy to all contractors, right? You're probably gonna, if they sign a contract with you, like as a contractor, then I'd probably put a copy of that same safety policy for all, right? And somewhere in that packet too. But before beginning on-site work, clarify all the responsibilities of anybody or contractors by providing them training, selecting and providing PPE, recording and reporting injuries and illnesses, and procedures for communication between host employer and all contractors. Like, how am I communicating with the workers here? Am I calling a certain specific supervisor, and that supervisor talks to all the people, or do I just talk to them all directly, right? Depends. And then you want to get worker participation. And then I would say, like if you really have staffing agency workers, or you have union workers, and then they only work there for a time. If I were the business owner, right, or the manager of the company or whatever, right, or the owner of the company, I would try to get exit interviews from the staffing agency workers and union workers to see what they felt when they were working there, because that's a very unique perspective, right? If you bring a staffing agency employee, they only work there for a couple of weeks. There's no fear of retaliation from any other person, so you can ask this person for feedback for your company. I think that'd be very helpful for improvement of your company, right? So also provide hazard identification and assessment tools, and also make sure that there's a pre-job hazard assessment of the work that they'll perform. So you're not just telling, oh, you're here, great, you know how to do the job, okay, get to work. But you and this contractor are actually looking over the hazards together. And then you want to prevent and control. So make sure that the workers know how to control exposures to their hazards, right? If you need to train them, probably got to do that. And then educate and train, and watch out for any qualifications that are needed from the roles that you need, especially if you're dealing with temporary or contract workers. And you need to make sure that they receive standard specific training or site specific training. So evaluation and improvement. You want to track metrics, track data, and all contractors should participate in the evaluations. I would say, again, I would encourage contractors to do exit interviews and then share the results with your contractors so that they know that you know what your feedback is for them, and any temporary staffing agencies who can inform the affected workers of the results. So make sure that you're again trying to improve, keep that mindset. So what are some methods to control workplace hazards? Right, so what are the benefits of effective controls? Well, it helps avoid injuries, illnesses, and incidents, minimizing, eliminating health risks, and then helping employers provide a safe and healthful working condition, which again is better for retention overall. So whenever you're thinking about it in the future, make sure to involve your workers, involve them, because they're your front lines for understanding and controlling hazards. Okay, so here's the hierarchy of control again. Use a hazard control plan and make sure that you develop a plan, right, that workers can protect themselves during emergencies and non-routine activities, and make sure that the existing controls are effective. Okay, so get to lunch here pretty soon. Remember that OSHA encourages employers to create a proactive approach for finding and fixing hazards in the workplace. And an effective safety and health program will increase worker involvement, management commitment, and allows employees to be better managers of their personnel, resources, and environment. Okay, knowledge check, and we'll take a lunch here. Which of the following is a benefit from implementing an effective safety and health program? Anybody there? No, guess not.
I'm here, but IDK.
Oh. Okay, so the answer is going to be all the above. All right, that's your benefit for implementing a safety health program. All right. Which of the following is the direct cost of an accident? Going to be physicians' examinations.
I don't think you're sharing your screen.
I'm not? Oh. This whole
Well,
time?
not on my phone at least.
It says I'm sharing the screen.
It's not showing up on my phone. But it's all good. I could listen.
Maybe the video. I mean, I don't know. My video is turned on. Let me see. So let me see if it does anything if I do that. All right. How about now? Nothing?
No, nothing. But it's okay. It's all good. It's probably just how the phone set up.
Okay. All right. We're almost done here anyway. So, okay. So employers must correct all that. So let me read the options for you here. So employers must correct all identified hazards. However, which of the following hazards should the employer work to correct first? So remember, these need to be corrected, but which one should you correct first? Guard missing on a piece of equipment used every 6 months. That's A. Broken rung on ladder used daily by entire crew. That's B. Loose handrail on a dozer used by a single equipment operator. That's C. And then wet floor by an eye wash station in the path not traveled by personnel. D. So what do you think is the most prioritized thing to fix first? So if you think about, if you heard something that requires more people to use it more often, then that's probably the one I'll try to fix first. And it's gonna be the broken rung on the ladder used daily by the entire crew. Okay, so, all right. So it's now 4 minutes until noon. So we'll go ahead and come back by 12:30. Welcome back. What's going on with these? Huh. Hmm. You guys, do you guys see this? Taeyeon and True.
Oh, it's on mute. Yeah, I see it.
You do? Oh, good. Who remembers the recent the stoppage at the canal? Right, if you guys remember, as one of the that container ship that got stuck and it delayed all the stuff earlier on. So that reminded me of that just now. I wonder what really happened. It's funny. All right, I'll stop right there. Okay. So True, do you see my screen now? Do you see the slide?
Yes, I see it.
Good. I'm glad. I'm so glad because now, okay. Because this is the video what I'm going to show you next, right? For the class. We are going to be getting into confined spaces. All right, we're gonna take a look at that right now. And if you see this on the screen here, I have a video from the United States Chemical Safety Board, USCSB. And this is an actual event that was pretty much summarized in 15 minutes. So, this is kind of the benefit of doing some type of a safety class, right? Because now you get to really see beyond what you're most used to seeing, right? And now, while you may never necessarily yourself enter into a confined space situation, the knowledge of what you learn, like what you get from the process, which what I'm saying is learning how to analyze issues, right? It's really, you get a real life example, right? And now you should think about, okay, well, what do I take to the next job? And if we're even have to facing not necessarily entering a confined space, but a dangerous situation, how do I think about analyzing the situation now, knowing what I know from lessons learned in other parts of industries, right? So that's what I'm talking about here. Okay, so I'll play the video. See, there's no ads on these guys. They don't get many plays.
October 2nd, 2007. A terrible tragedy unfolded in the mountains 40 miles west of Denver, Colorado. 5 contract makers were hacked by a chemical plant deep inside a hydroelectric plant tunnel. The plant was owned by Shell Energy. The fire, involving combustible coatings and solvents inside the tunnel, blocked the only way out, opening more than 4 feet. There was no help available because the company did not have properly trained emergency responders. For the workers, the Chemical Safety Board found that neither Shell Energy nor its contractor, RPI Coating, had adequately evaluated the dangers of the work inside the tunnel.
The RPI contractors entered confined space with highly flammable solvents, little training, and no emergency plan. From the moment we entered the tunnel, the stage was set for disaster.
Shell Energy's Cabin Creek hydroelectric plant is located in a remote mountainous area, approximately 6 miles from Georgetown, Colorado. A 4,000-foot tunnel, known in the industry as a penstock, was slightly inclined at the bottom and extremely steep at the top. The penstock carried water between the upper and lower reservoirs. At the bottom, water flowed through large turbines to generate electricity. Over the years, the penstock lining deteriorated. In 2007, Shell Energy contracted with RPI, an industrial paving company,
to recoat a large steel section of the penstock near the power plant in Lower Reservoir. Work began at the site in September. The penstock is a unique confined space. It's difficult to enter and exit. Before the project began, a door was cut into the lower section to provide access for workers and their equipment. On the morning of the accident, October 2nd, RPI workers prepared to begin the coating operation by bringing approximately 10 gallons of a highly flammable solvent called methyl ethyl ketone, or Ppe, into the penstock. Some of the solvent was used to clean the equipment and hoses before starting the work. Shortly after 1 p.m., 11 workers began coating a section of wall located more than 1,400 feet inside the penstock. To apply the new two-part epoxy coating, workers used a specialized sprayer. Base and hardener were mixed and then sprayed onto the walls. But the workers immediately encountered problems. The epoxy was not adhering evenly to the surface. The workers flushed the hoses and spray wands with Ppe each time a problem arose. But despite their efforts, they could not get the epoxy to adhere evenly. An RPI foreman decided to clean and remove the sprayer from the penstock. The crew began cleaning out all of the equipment and hoses using Ppe. A worker brought in more of the flammable solvent to aid him. Some workers noticed the strong odor of Ppe as the vapor spread through the work area. At approximately 2 p.m., the vapor was ignited, most likely by static electricity, inside one of the spraying machine houses. A flash fire erupted. Burning solvent burst from the hopper onto a nearby worker, catching the sleeve on fire. The flames spread quickly, engulfing the open buckets of Ppe nearby. 5 workers were blocked from escaping the penstock by the intense fire. The trapped men shouted desperately for fire extinguishers, but there were none inside the penstock. Workers on the other side of the burning equipment ran the 1,400 feet to the entrance to locate fire extinguishers. One worker notified the control room operator to call 911. The 5 trapped workers could do nothing but close the entrance. Inside the penstock, nearby buckets of epoxy and Ppe burst into flames. The trapped men fled deeper into the penstock to escape the smoke. They used their radios to communicate with the workers outside, imploring them for help. Workers repeatedly attempted to fight the fire with portable extinguishers, but they were forced to turn back by the intense heat and thick black smoke. Inside the penstock, the workers continued to work for rescue. At 2:11 p.m., county emergency personnel arrived at the site in response to the 911 call. But they had not been informed about the hazardous conditions within the penstock, and they were not equipped or trained to attempt such a technically demanding rescue. The trapped workers were instructed to move even deeper, but they stopped when they reached the inclined section, which was too steep to climb. They told responders they were struggling to breathe as smoke filled the penstock. Some of the responders entered the penstock on an all-terrain vehicle, but the dense smoke blocked their path, and they had to retreat after just 200. The responders then drove up the winding road that rose over 1,000 feet to the upper reservoir. There, they lowered air bottles and respirators through a small hatch, hoping these would reach the trapped workers below. Finally, at 3:40 p.m., a specialized rescue unit arrived from Denver, some 40 miles to the east. A short time later, a specialized mine rescue unit arrived. The teams prepared for entry. The 5 workers inside the penstock had died of smoke inhalation. The following day, responders found their bodies.
The CSV found that the accident at Excel's cabin creek plant highlights three key safety issues. The lack of regulatory limits for bringing flammable materials into permit-required confined spaces. Excel Energy's flawed process for contractor selection and oversight. And the lack of preparation for possible emergencies.
Confined space technical rescue poses many unique challenges for us as emergency responders.
Captain Steve Azeltine is the Division Chief of Training for the West Metro Fire and Rescue District in Denver. And his team responded on the accident at Excel Energy.
A confined space is not meant for continuous human occupancy as a small ingress and egress point. A permit required confined space is any area that can have an atmosphere that's immediately dangerous to life or health. You're required to have a rescue team on site and professionals there to help you in a permit required confined space. And most times we see people just blow that on. And unfortunately, those are the people that don't get to go home.
There were 45 minutes between the incident. Like the last radio conversation with the workers. That's a significant amount of time.
The fact that there was 45 minutes before the last radio communication, probably said there probably would have been enough time had an emergency responding group been there and been prepared to handle the chemicals inside, potentially put it out and rescue the individual.
The nearest community emergency responders trained for confined space technical rescue were located over an hour's drive away.
The fire department in your local area may not have a confined space technical rescue team. They may not have that specialized level of training. They may have to wait for that kind of response. And if you're the person down in there that is in a low oxygen environment, you don't have time to wait.
To increase the availability of such specialized responders, the CSB recommended that the state of Colorado develop a new firefighter training certification program for confined space rescue. The CSB determined that when Excel Energy was selecting a contractor to recoat the pedestal, RPI did not have an acceptable safety method based on Excel's own evaluation standard.
In the safety category,
Okay.
RPI was evaluated to have a 0 on a scale.
I'm gonna pause right here. So 0 on the scale here, okay? So so they talk, the beginning of this is called contract selection, right? Or sorry, contractor selection, sorry. This is this section right here, right? So they said they had a flawed process for their contract selection. So what I want to show you here, let's see if I can get to that. All right. So anybody ever done an RFP before? So what an RFP is, it's a request for proposal. So you want to put a bid in for a job, and you are requested for a proposal, right? So that's what it's called in the industry. There's also another version called an RFI, request for information, and that is a preliminary RFI, RFP, and then an RFQ. RFQ could be it stands for request for quotation or request for quote. And for that particular type, usually it's like just most of the time it's product more, like a quote on a just a final product. It's common, so you need a quote. Proposal is more on the side of we're building this, we're getting materials, we're getting some work done. So proposal is like, well, how do we propose to finish the job, finish the project, whatever, right? So this is an RFP, and what you're seeing right here is exceptions to terms and conditions. So Excel Energy is the company that has the job. They have terms and conditions based on whatever their company has. and they rank your company bid based on their own criteria. Price was the next one, and then completeness of proposal, and then safety, emergency, medical record. Right, so EMR, so whatever that EMR score is. So when you play this,
In the safety category, RPI was evaluated to have a 0 scale.
so but look at this, look at the ratings here, right? They're good on completeness of proposal, they're good on price, and they're 4 at the terms and conditions. So, and 0 there, right? Now, look at this right here, right? So you see this part right here? So this is the bid, apparently, right? It's $1 million. And if you look to the, I mean, the video doesn't give you much information, but I was curious, right? So what's this number over here by where my pointer is, you think, right? Next to the 3 looks to me over here, right? First of all, this T right here looks like it's another contractor. I mean, that's another contractor that put a bid in. And that number looks like a 9, right? So all I wanted to really tell you, right, was that those lives, all of them in total, cost just for the cost of $70,000. Those people died because of $70,000. Think about that for a second, right? Would you literally be willing to trade a life for, no, not even a life, it was like 5 lives for $70,000? That, you know, that wouldn't be worth it, right? You wouldn't even want to go into that kind of thing. So if you did that kind of thinking and thought beforehand, right, you know, they had a 0 rating, and then this other company had a 4, right? The only thing they suffered at was the completeness of proposal. It wasn't that great, right? So they had a low number there, which drove their score down, and they had a better price. So they're like, yeah, you know what? It's our own system. We can say what we want, and we'll pick these guys anyway. Oh, and we're gonna watch, yeah, the safety part, sure, no problem. We're just gonna watch over them, right? And make sure that they're doing their job properly. Well, you kind of know what happened.
0 to 5, and that was the lowest possible rating. However, that did not prevent RPI from winning the competitive bidding process, largely based on low price.
Excel officials determined that another coding contractor had better technical qualifications than RPI. However, that company's estimated cost was higher than Excel's budget for the project.
Excel did consider safety to be one of the criteria by which RPI could be disqualified.
Excel did plan to closely monitor RPI's safety performance during the project. However, the CSB determined that Excel's oversight of RPI remained inadequate. The CSB recommended that the Colorado Public Utilities Commission develop rules governing the selection and disqualification of contractors based on their safety records. The board also urged the commission to require regulated utilities to investigate and report to the public on all serious accidents. In 1993, OSHA issued a regulatory standard for permit-required confined spaces in general industry. But the Chemical Safety Board identified 53 serious accidents since 1993, where flammable atmospheres led to fires or explosions inside confined spaces. These accidents caused a total of 45 fatalities and 54 injuries. Most of the fatalities and injuries have occurred since 2001. Existing good practice guidelines recommend against working in any confined space where the concentration of flammable vapor exceeds a specific low percentage of the more explosive limit. That is the lowest concentration of flammable vapor in air that can burn when ignited. Concentrations below the lower explosive limit for LEL are too lean to burn. Concentrations exceeding the upper explosive limit are too rich to burn. Overseas regulations, as well as certain OSHA standards, including the OSHA standard for shipyards, prohibit work inside a confined space if the atmosphere exceeds 10% of the lower explosive limit. However, the OSHA General Industry Standard, which regulates over 4 million permit required confined spaces across the country, sets no such thing.
This was in 2009.
Chemical Safety Board believes that the limit must be set conservatively because atmospheres can change quickly.
Okay.
Although monitoring is essential, it may not always reveal the full extent of the hazard.
If you don't establish limits, how are workers know what is safe and what isn't? And it undermines the importance of the recognition of those hazards of a flammable atmosphere.
In its final report, the board called on OSHA to amend the permit required confined spaces rule for general industry to prohibit entry and occupancy if the atmosphere exceeds a specified low percentage of the air.
So the rules were changed after this video was made.
The incident at Cabin Creek will affect me for the rest of my career. Do I hope that that never happens again? Absolutely. Nobody ever wants to see this type of incident occur. And we need to help prevent that value. Often companies do not properly consider the danger of working with the vehicle. Companies and contractors diligent about assessing those hazards, controlling the risk, planning for possible emergencies. We hope that our investigation and this video will help prevent similar accidents in the future.
For more information about the CSD investigation of the accident at
Okay.
Excerpt,
All right, we'll go to that. All right. So, all right, so that's the video. Paints a good picture. If you're able to follow along. Now, I hope that it doesn't get like choppy on you guys when you're watching it. That'd probably be really annoying. Does that ever happen for you guys, Chris, True, or Tian?
A bit, it lags, but I just watched the video on my YouTube alongside your video. That's what I do.
Oh, okay, okay,
Yeah.
perfect. Oh, so you look for you look for the link and then you found the video through another device. Okay,
Yeah, and I just follow along.
perfect, good. That's awesome. Okay, good call on that. Okay, well, hopefully you got some of that, most of that video. I know you popped in there, so thank you for joining us back. So confined space, there's a lot of very unique situations in confined spaces, and that's why. Now, so why did I say in the beginning, you know, what can you do? What can you take from that video that you can just take into, you know, general industry, safety and health mindset, right? Well, the mindset is proper hazard assessment, right? What they didn't do, what Excel Energy didn't really do was properly assess the hazard, right? It's becoming, with incidents like that happen in our own history, in our own country, it's going to call attention to, you know, more process be made better, or they, you know, make the fines more stiff. You know how the serious penalty is like 70,000, right? Well, that 70,000 penalty, you know, is probably, well, it's like for each person is probably like, you know, they have the max. I think there's other things too with fatalities. That's why it's like $130,000 fine for a company, especially when, you know, if you remember that our article I shared with you for the AB specialty silicones, the volatile chemical plant, right? Whatever happened there. So this is just it's a thought that you should really be aware of your surroundings, really know what is a dangerous situation, right? Really understand what can harm people. That's what I think we should really get from this module, right? What can really harm people? And we take it to that extent. So there's in the video, the fire chief, that fire police chief, or the fire chief, sorry, why did I say fire police? Fire chief was describing a confined space and a permit required confined space. So confined space is pretty much a space where it is not really meant for people to hang out in, right? Not designed for continuous employee occupancy, right? So, I mean, that's one of the qualifiers. And, you know, even if it's not something that like traps a person, like let's say you're inside of like that, like that kind of a pen stop, but both sides are open, right? That would still be considered a confined space. Okay, so because it's not really designed for people to hang out in, right? Right, so that's what and of course the employee's body must be able to enter that space. It's confined space. Now, a permit required confined space has one or more. So even if it's just one of these characteristics, then you already need to have a program, right, that is called permit required for that confined space. So that is pretty much, well, you know, it's going to fall under your confined space program, and then you're going to talk about the permits that are required to use. And remember, when you think of the word permit, I know you might be thinking, you know, you get a permit from the city of Long Beach for installing a HVAC system, right? Okay, that's also getting a permit, yes. Here's the thing about permit, right? If it's your company, it's within your company's grounds, then it's going to be your permit system. It's going to be your authoritative body to approve or not approve that type of entry to be done. Okay, so that's what permit required really means. It's not like going to the city and getting a permit for something. I know when you install stuff in your home, you're supposed to get a permit from the city. That's building, you know, that's a housing ordinance. There's rules there, right? This is for business. So if it's your business and you have these spaces, you obviously know what you're doing with them because they're on your site, right? Like tanks or, you know, anything that holds. You see you'll see some of the next examples here. But one or more characteristics, if it has the ability to contain hazardous atmosphere. Okay, that's very broad. It sounds very broad, right? What's a hazardous atmosphere? We'll describe it later on. Material has potential for engulfing the entrant. Engulfing is basically like surrounding, right? So it could be the form of solid, liquid, and gas, although more so on the solid and liquid side for engulfment, right? And then internal configuration where you can be trapped and they're walls that are inwardly converging. And I can only just easily explain it like this. That's it. It's pretty much inwardly converging walls. Like that, if this is a space, right, and someone's inside, yeah, that's a permit required confined space because it's inwardly converging walls. They're not flat. Or it contains any other serious or serious safety or health hazard. Okay, and we'll also describe those. There's the examples. Okay, so now, okay, the one thing that you saw in the video, okay, now what's the requirement? So permit required confined space right here, this is it, right? If you have a permit required confined space situation, right, you are now required to have emergency services on site before entry happens. Okay, that's very important to know. And so if you're already putting somebody's life in danger, if it falls under those definitions of permit required confined space, you're already supposed to have emergency services on site that are able to perform the rescue that's necessary, right, for that. So it would be a good idea for the company to know how to describe their situation, right, the space of entry, to any company that's going to be performing the service, you know, to do whatever, right, to do the emergency services for that entry. So you need to be able to describe the space, right, to be able to describe the characteristics. Here are the definitions. Okay, so it is an internal configuration of open, or there's nothing there, right? It's obstructed, whether it's something that you have to bring into the space or something that's already there. Anytime where you have to actually maneuver, then you have to actually say it's obstructed, okay? Whatever you bring in there counts. So elevation is elevated if it's greater than 4 feet, 4 feet or higher. And then if it's less than 4 feet, then it's considered non-elevated. Okay, it'll make it easier for people to get out, get in and out of a non-elevated space, because you don't have to bring any ladders, you know, anything like that, right? You can get in pretty easily. Portal size is considered restricted if it's less than 24 inches in the least dimension, and considered unrestricted if it's greater than 24 inches in the least dimension. Now, what is the least dimension? Well, if I draw one for you here on my board, right? Quick second, right? So when you're drawing when you're going into a space anyway, what they say is least dimension, right? Is you take this space right here, right? And you say, okay, well, this is a big side. This would be the least dimension side, and this least dimension side, if it's less than 24 inches, right? Then what? It's considered restricted, right? If it's greater than, then it's considered unrestricted. Okay, so cool. Let me come back here. Thank you. Okay. Next one is the portals. Oh, I went to portal size already. Space access is considered horizontal if the portal entry is on the side of the permit space, right? Makes it hard to retrieve people from the side. Or if it's vertical, it's on the top of the permit space. And if it's on the bottom, people have to climb up into the space, right? You have to know certain types of special patient packaging, right? Rope techniques to be able to get the person out of that space. So being able to describe those characteristics to a professional, right? It gives them the ability to say, okay, well, okay, yes, we can do that. We have the ability, blah, blah, blah. Here's the equipment we need. Okay, so when we come there, boom, 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 right? So there is no need, if you catch the video, if you get a chance to watch that video in the beginning I showed, then you have enough time to save people when you're already ready, right there. And there's that famous saying, that I happen to hold on to for a very long time, and since my 20s, and I'm in my 40s now, right? And the saying goes, if you stay ready, you ain't got to get ready, right? And if you know my reference to that, then Sugar Free, pretty darn good rapper, I think, right? So if you stay ready, you ain't got to get ready. And so when it comes to emergency situations like this, where you're required to have emergency services, well, you better have them on site before you attempt an entry. All right, so now let's take a look at elements of your permit required confined space program and some elements you have to define, right? We'll look at some of these in more detail. So this is like the beginning part, right? Okay, so appendices are they're necessary if they apply. And if you have the book, it'll look like the Appendix A right here that I have for the next slide will look like this on your book, so you can see it large ways. You know, it's bigger, but I actually had loaded the incorrect slide deck. Mine actually shows it the other way where it's facing upwards and we can see it, but you get the idea. This is actually a fully compliant permit required confined space decision flow chart that if you just look online and just Google search it, you'll find the same thing. That's where I got it. Right. So let me introduce to you our permit required confined spaces YMCA team that's going to enter the space. Right. And you know, like the Macho Man look there. So first person we're going to define is going to be the attendant. The attendant is somebody outside the space who monitors authorized entrance and performs all the attendance duties assigned in the employer's permit space program. Okay, so that's the attendant. And then the attendant should know the hazards that whoever is entering, what they're facing when they're inside. Must be aware of the behavioral effects. So, you know, how the person will look like if they're affected by whatever is in there. Continuously maintains an accurate count of authorized entrants, right? If a person is going inside of that, then then a whole body better come out, right? And then they remain outside the space during these operations until relieved by another attendant. So they don't go inside the space ever. Okay, so this the attendant communicates with the entrant, the authorized entrant. They monitor activities inside and outside the space to make sure that everything is okay, the person is safe. They have to summon the rescue or any other emergency services, especially when stuff goes down. And they perform non-entry rescue that they can do. So imagine that tripod that you're gonna see this coming up next right there. See that system where they're going down into, that would be a retrieval system. That'd be the only type of non-entry rescue that the attendant can do. They don't try to reach their hand there, try to pull them out. I mean, unless they're really that strong, I guess. But that puts the other person at risk because they can both fall in, especially if he's not tied off to anything. And again, the attendant is not doing anything else other than looking over that person's life that's inside of the space they're entering. Okay, so this person that's the attendant, they're not doing any, you're not giving them a laptop and you're telling them, here's some receipts and can you enter these into QuickBooks while you're watching over the guy inside the space? Like, no, that doesn't happen. You don't do that. Right? So now let's talk about the authorized entrant, right? The person that's going inside the space to do the work. So the authorized entrant, of course, you have to be aware of what type of dangers you're facing when you're entering a space, or how it will feel, or how it might look, or how you might act if you are experiencing it, right? So proper use of equipment and communicating with the attendant, because sometimes they may call for evacuation. So the entrant will alert the attendant whenever he sees something wrong, and or if he's being told to get out. So you exit the space when you're told to leave. When the entrant says, no, can't put me in here because it's dangerous. Or if there's an alarm sounded, of course, then you have to get out of the space as soon as possible. All right, so there he goes, and he is not happy with the smell that he's smelling inside there. Not at all. All right, so you can say he is being engulfed by a smell, but that's not really what we call that, right? Engulfment, by definition, is a surrounding and effective capture of a person by liquid or finely divided flowable solid substance, right, that you can actually breathe into, that can be aspirated by causing death, or that can plug up your respiratory system. So engulfment, right, there's, it says there, liquid or finely divided flowable solid substance. Grain, corn, right, wheat, barley, whatever, like milled wheat and barley and whatever, right? Yeah, that can engulf you and you can breathe it into your system, or it could crush your body, because if it falls on you and you got it in from a silo, then get crushed. Or exactly what I was talking about, right? Engulfment can exert enough force on your body that can cause strangulation or crushing, constriction, right? Imagine a boa constrictor crushing you, right? That's kind of the same thought process of being crushed by engulfment. So another definition is entry, and entry means whenever here's a space, right, of enter, right? And if I got my hands in there, my fingers, yes, I am entering the space. If I am entering the space, I better be permitted to enter that space, because I would be an authorized entrant. And if I was not an authorized entrant, I would have to be kicked out by the supervisor, okay? So the entry is defined as entering the space when you break the plane of opening into space. People joke around opening into space, like space, outer space? No, space like the space that you're working into, the confined space. Entry supervisor. So entry supervisors are the ones that are going to sign off on the permit saying, we're good to go, let's go inside, right? Or you go inside, that is. So they're either the employer, the foreman, or the crew chief. They're responsible for determining if acceptable entry conditions are present. And they see and make sure that once they're done, that they terminate entry or they end entry. Now, you may find that it's helpful for you to have cross-trained people, because supervisors can also be attendants or the authorized entrant, as long as they're properly trained, right? And so you may find that cross-training people will be good, because that way you can have teams that can just work together, no matter how many, no matter who's available. Then you can put together a team of 3 and they all can work together. Right, so now more duties of the supervisor. So supervisors better know what their people are being exposed to, right? And they verify and check all of the tests have been conducted, and that they know for sure that they've done all of the steps required to determine that it is safe, in fact, to enter. Supervisors also terminate the job once it's done. Supervisors will verify rescue services are available and you can call them when you need them. Okay, removes unauthorized individuals who enter or who attempt to enter. Yeah, so I was just telling you, right? Supervisors got to play a little bouncer. Got to stop people from going to the space. Even if the person owes them money, you're like, nope, you got to collect after work. He's on the clock. Determines whenever responsibility for a permit space entry, if you transfer it to somebody else, right? That supervisor's job is to make sure to document all that. And also to make sure that the conditions for entry are still, they still exist. All right. So now let's define hazardous atmosphere. Okay, so if it can if it can be determined that you are exposing yourself to risk of death, being incapacitated, you can't save yourself, or being exposed to acute illness, so a really bad illness, or you are entering an area where the excess of 10% lower flammable limit exists, it's a flammable situation. Well, that's hazardous atmosphere. Any dust that can exceed the lower flammable limit. So imagine combustible dust. You know what that is? That's like sawdust. That's combustible dust, because it can actually, sawdust is pretty much wood, and that can catch fire. That's a hazardous atmosphere. You might think to yourself, oh, it's just sawdust. No, that can ignite, right? Or if your vision is obscured, where you can't see more than 5 feet in front of you, that would be considered a hazardous atmosphere. And not being able to see 5 feet in front of you is pretty dangerous. And then if you have oxygen less than 19.5, what do you think happens to human beings? Right? We don't like that. 19.5, that's, get ready to die, right? That, because you don't have enough oxygen. And then 23.5 or more, right, is if you have too much, right? Now, it's not good for you. And there's potential for ignition too. This is more concentrated. Oxygen can ignite. Actually, that's a common misconception. Oh, oxygen. Think about it, right? Oxygen. A fire needs oxygen to keep burning, right? And now you're getting a real concentrated amount, 100% oxygen, and then you put some ignition to it. Yeah, it's gonna cause a poof, right? It's gonna do something that could create pressure. So yeah, fun stuff, right? So what else is considered a hazardous atmosphere? Well, if it's permissible, if you exceed the permissible exposure limits, then it's considered hazardous, right? Because you've exceeded the permissible exposure limit, right? So that's a hazardous atmosphere. And then there's a note here. It says that if whatever concentration of substance is not able to cause death or incapacitation, impairment of ability to self-rescue, right? Then, or it can't cause any disease or illness, then not covered under OSHA. All right, why bother? If it's not gonna kill anybody, you're fine. So when we talk about a condition that is IDLH, you'll see that definition next. So for any air contaminants, which OSHA has no established permissible exposure limits. And here's an example of this. I had a gentleman who's a veteran, worked for a battery company, right? And they're not just any battery company, right? He was working with a EV battery company, and they were trying to come up with ways to be able to fill the demand of EV batteries. Right. So what do? They started trying to experiment with different types of systems to, create or to store energy with cars and things like that. So, so there's all these new substances they're trying to make. So if OSHA has nothing set for it, then the company has to be the one to provide guidance and establishing what's dangerous, exposure levels for whatever they're making, right? So, they create their own SDS, and come to think of it, right? They have to put in an area the chemical composition of whatever they made, right? So they're putting it there, and then of course through the time and them understanding what they're making, they also know, that certain levels are bad for, you know, like for your personal health if you expose too much. So yeah. So now, what is IDLH? Stands for immediately dangerous to life and health. Another definition is eminently dangerous to life and health, which is basically the same thing. So IDLH does not necessarily mean it's right away. It could be delayed, right? So any condition that poses immediate or delayed threat to life or cause irreversible or adverse health effects or interfere with an individual's ability to need help to get out of somewhere. Okay, so that's IDLH. In lockout tagout, we did talk about isolation. Right, we talked about this is actually one section of, well, not a section, but isolation is just the way that you disconnect or you make not part of the system so that you're able to work on it and things like that. That's isolation. All right, and then another definition is called line breaking. So line breaking is, is an intentional opening of a pipe, line or duct that has been carrying corrosive toxic material. So this says that it's already had it before, and you know, at some point, that's what you're trying to do, is to line break. Okay, so that's the definition of line breaking. Is you're trying to open something up, but it used to have something that was dangerous for people. And then personnel rescue services, right? It is the duty of the employer to make sure that they have proper rescue services available on site. And then, of course, the employer will also be responsible for making sure that the emergency company that they pick can do the job that they're describing, especially because that's all going to fall on the employer, because the employer is the one that has to pretty much try to source the resources for them to do the rescue and emergency services when it's needed. Oh, there's a guy. Well, he hit the ground, and they're trying to resuscitate him. They're trying some. Well, they're seeing if he's breathing. So the retrieval system, like I mentioned to you earlier, that's the retrieval system for if you're going into openings where you're going down, pretty much, right? That's pretty much what they're really good for. So it looks like, and there's that. If you notice right there next to him, to his head, there is a ventilation system right there. But whatever happened, he still got knocked out. All right, so another definition is called testing. And this is a process by which hazards that confront entrants are identified and evaluated. So this is where you really do your due diligence, your homework, try to figure out what the heck is in this thing to make sure that we're not leaving any stone unturned. Because if we did, then we might hurt our employee, and that's not good for anybody, right? All right, so we're talking about testing protocols. We want to make sure that we have the ability, and also we have the you gotta check that space first, right? So when before you let a person enter into a space, you gotta check for oxygen content, make sure there are no flammable gases and vapors, and then you talk about potential any toxic air contaminants. Someone might say, gas from your body is a potential toxic air contaminant, right? So you know, gotta be careful what you're calling that, but do your testing. Now, you know, the best thing to do is, of course, get readers, right, to make sure that, you know, you can be accurate, well, you know, close to accurate with what you're trying to detect. So here are the other hazards. Do you think these are hazards? Oh, yeah. So these are hazards you don't want to mess with right here. Even if you think that they're not poisonous, then you better just, no. Is this a permit required confined space? I would say, yeah. It's a scary confined space. And then this is some of the signage that is used. That would be a permit required confined space because it's really, I always say, hey, if there's more than 5 rivets, I mean, what are you really trying to keep in there, or what are you trying to keep out of there, right? Sewer systems, definitely permit required confined spaces. There's just too many things inside of the sewer that, you know, it's pretty gross. Anyway. So this is a barge, and if you can see all of the mold and rust, yeah, this is also a good a queue for a permit required confined space program to take place. Okay, so that's a example of a permit. I got one for you actually at the end here. So this is a outline for your plan if you are in fact going to be, you know, potentially entering a permit required confined space situation. And then, oh yeah, so I talked to it on the side too, but that's what the confined space entry permit looks like right there. And are there any questions from permit required confined spaces? I know you probably be like, I'll probably never do this, but and I know that a lot of individuals are always kind of asking for that. Oh, so how does this, you know, fit? You'll be surprised. OSHA is just they're not going anywhere. Okay. So that was a quick one, right? It's like half an hour pretty much. Maybe more than an hour, right? Well, under an hour at least. Okay, so next one is going to be Hotwork, and I have a video for you on that one too. And then so here's what I'll do. We could do this. Let's make a 10-minute break. It's 1:35. Let's come back at 1:45. Okay, so
Okay, I have to get going, sir.
yeah, that's right. You have your interview. Good luck.
Thank you.
And then you can actually, what I'm gonna do here this evening, since this is the last day of OSHA, right? Okay, so a couple of announcements before you take off, Chris. Thank you for reminding me, right? So tomorrow for you, Chris, you can you're gonna be are you gonna be able to come in tomorrow?
Yeah, I will.
Perfect. Yeah, so I'll see you here.
I do have work at 3 though tomorrow.
Oh yeah, you're fine. I mean, we'll you know, get stuff done, and help you out with your resume and things like that. So that'll be tomorrow. And then for the rest of you who are going to be completing the training program, you will be reviewing tomorrow with Chief. Start time 8:30, right? And then the exam will be shortly thereafter. So you guys are basically reviewing for about an hour or so, maybe under an hour. And then maybe by 10 o'clock is when the test will start. So and actually, if you get here between 8:30 and 9, you're fine. But that's why I say 8:30. Just set in your mind 8:30, and you'll probably get here by 9, right? So that I'll give you that little buffer. And so the review will happen. Take the exam, and then by the time you guys are done with the exam, and we print off your final certificate for the project management one, we'll give you the whole set of packet list, and then you'll be able to take off for the day, right? Before we get a photo too, right? So wanted just to make sure that we're all on the same page here. And then and for the videos itself, if you want to review them again, I'm definitely going to be, since this one is going to be a complete set for me of 4 days, and then it's continuous. So I'll upload these to YouTube, and if you would like for me to provide you a link, then I'll do that for you. Just email me, because I don't want to like email you and then you didn't really want it, All right, so
and as for me tomorrow, do you know anything else I need to fill out to be able to get the OSHA card? Is it something that is mailed to me, or is it given to me there as well?
you gotta also sign my sign-in sheets for sure.
Okay.
Because I think there's one day you didn't sign. So
Okay.
right, it's okay. We got to take care of that.
Okay. So I'll come in and get all that done, and then so that's okay. Thank you.
Yeah, we'll see you tomorrow. We'll take care of it and make sure that everything is taken care of for the OSHA card. Yeah, absolutely. Yeah, it takes a couple of weeks for you to get it, because I have to submit the order for the cards, and then it'll be probably 2 to 3 weeks. Sometimes they've been kind of slow because of COVID, apparently. But yeah, that's what's happened. All right, Chris. Well, you better. How far is it here in Signal Hill?
It's in Gardena.
Oh, Gardena. Okay, that's what you did tell me.
Yeah.
Great. Okay. All right, man. Well, good luck to you.
Thank you.
We'll catch you tomorrow then. Tell me how it goes. All right. So let's go ahead. Oh, I did say 1:45, didn't I? But I think we had people kind of drop out for a second. So oh, you know what I could do? Yeah. I forgot a minute. There we go.
Goodbye in the stand fall. Hello to a phone brand built in stand line. See you later. I'm saying.
Oh my goodness. No. That's good. I timed that one. All right. So okay. Okay. All right, so this one is another video.
Small business owners use
on Hotwork. I'm also using another video from the USCSB, Chemical Safety Board.
In 1979, 20-year-old John Capano was a contract worker performing maintenance at New Jersey refinery. We actually had pulled out of the refinery and were contracting with the one last job, which was demolish an old pumping station. There was not a water line, it was a crude water line. We tried to dismantle the pump, starting with removing the bolts from the flanges, and they were so corroded that we couldn't get them loose by conventional means. So we elected to use an acetylene torch at that point. As soon as the flange separated, it exploded. 30 years and over 75 surgeries later, Mr. Capano now assists other burn survivors as they recover from their wounds, often suffering on the job. Don't think that something this tragic could happen to somebody else. This could happen anywhere. John Capano's life was changed forever by a hot work accident. Welding, cutting, grinding, seemingly a routine operation, until suddenly flammable vapors are ignited by sparks or heat. We typically hear about hot work accidents weekly. It's become one of the most significant types of incidents that CSB investigates in terms of deaths, in terms of frequency. The Chemical Safety Board found that since 1990, welding, cutting, and other hot work on or near flammable storage tanks caused fires and explosions that led to over 60 deaths. In February 2010, the CSB issued a safety bulletin outlining 7 key lessons to prevent hot work accidents. The bulletin followed a tragic explosion that killed 3 paper mill workers in Wisconsin in July 2008, together with 10 other serious hot work accidents investigated or reviewed by the CSB. The main message of the CSB safety bulletin is to conduct an effective hazard evaluation and perform gas monitoring before conducting hot work. Proper use of combustible gas detectors will prevent many of these accidents and save lives. June 5th, 2006, a rural oil production site in central Mississippi, operated by a company called Partridge Valley. All the workers are contractors employed by Springer's Oilfield Services, hired to install tanks and piping at the site. They plan to connect the pipe between 2 of the site's 4 tanks. They empty a large storage tank, then check it for flammable hydrocarbons by a dangerous and unreliable technique, inserting a lit welding torch into the tank. Seeing no flash, the workers believe it is safe to weld on the tank. However, crude oil has remained inside one of the other productions, warming under the morning sun. Vapor from this oil flows into an adjacent tank and escapes through an uncapped pipe just 4 feet from where workers plan to weld. Sparks shower down from the welding process, igniting the flammable vapor. Flames flash back into the storage tank, causing an explosion which blows off the tank lid and the ladder where 3 of the workers were standing. Flames shoot through a pipe into the next tank, causing an even more violent explosion. 3 workers were killed, and the 4th was severely injured. CSB investigators noted that combustible gas detectors were not used at any time prior to or during hot work. Partridge Raleigh had not established safety requirements for its contractor, and the contractor provided no hot work safety training for its employees.
Hotwork accidents affect not only the oil and gas industry, but also across other sectors, such as food production, paper, and food.
Wow. And you're looking at, them, what are you doing? Clyde and I were married about almost 2 years, together about 7. We share a child. Her name is Leah Jones, and she is now gonna be 8, and she was 3 when he passed away. He's an all-around maintenance man at the water treatment plants in the city of Daytona Beach. I just assumed that he had a normal, everyday, and 7 to 2:30 Monday through Friday job. Safe as my job, and I would never trained in a million years. He would have been killed in a explosion.
January 11th, 2006. Clyde Jones is operating a crane at the wastewater treatment plant, while 2 other workers in a man-lift basket are removing a steel roof that covers 2 chemical storage tanks. One empty, the other containing about 3,000 gallons of highly flammable methanol. But no combustible gas testing is required or performed. The workers use an oxyacetylene torch to cut the roof into sections. Beneath them, methanol vapor vents from the top of the tank as the morning sun warms the liquid inside. Sparks from the torch shower down onto the tank, igniting the methanol. The fire flashes into a corroded and ineffective flame arrestor. Continues into the tank. Flames spread. Burning methanol spews out from broken pipes, engulfing the 2 workers in the man-lift basket. One survives, one does not. Flames envelop the cab of the crane.
When I got to Halifax, and I were able to talk for about 10 minutes before they ended it. He told me that he loved me and take care of the girls. And he knew it was bad. He just didn't know how bad. And he asked me if I would promise to stay with him until the end. And I told him I would.
The day after the explosion at the wastewater treatment plant, Clyde Jones was below housekeeping. The accidents at Bethune and Partridge Raleigh demonstrate the need to monitor the atmosphere for dangerous levels of flammable vapor. But monitoring must be done properly.
Ineffective monitoring techniques can be just as dangerous as no monitoring at all.
July 17, 2001, the Motiva Enterprises Refinery, Delaware City, Delaware. Several contractors are repairing a catwalk in a sulfuric acid tank line. The task involves cutting near storage tank 393, which contains waste sulfuric acid and flammable hydrocarbon. But the tank is severely corroded and has holes in its roof and shell. At about 7:45 a.m., Motiva operators use a combustible gas detector to test the atmosphere around tank 393. No flammable vapor is detected. They never test the atmosphere after that. But as the day goes on, the temperature rises by 14 degrees, warming the contents of the tank and producing vapor that escapes through the hole. But workers are unaware of the growing danger. Around 1:30 p.m., a spark from an electric arc cutting system ignites the vapor, causing a powerful explosion. The tank collapses. 264,000 gallons of highly corrosive sulfuric acid. The sulfuric acid overwhelms the containment duct and wastewater systems. Almost 100,000 gallons reach the Delaware River, killing fish and other aquatic life. A contract employee who had been working on the catwalk died in the accident. His body never found. 8 others were injured.
Combustible gas detectors should be routinely used to identify and monitor for flammable atmospheres before and during hot work.
More recent accidents illustrate the same key lesson. Gas monitoring was performed at Conagla Foods in Portland, Oregon on February 16, 2009, but not in the immediate area where Wilderness plant. Sparks ignited flammable gas from decaying matter beneath the water clarifier tank, causing an explosion that killed one worker. And 3 contract workers were killed at a TEPCO fuel terminal while they used a torch to cut into the roof of the gasoline storage tank. Gas testing occurred at 7 a.m. to start the work shift, but was not repeated when workers returned from lunch or when they started the hot work.
Continuous monitoring for flammable vapor could have prevented these tragic accidents, which caused deaths, injuries, and environmental damage. Other good safety practices are also important.
Whenever possible, avoid hot work or consider alternative methods, such as cold or hydraulic cutting. Before any hot work, perform a comprehensive hazard assessment. Personnel may sometimes be unaware of processes that can release flammable vapors. In 2008, 3 workers were killed and 1 was injured in Tomahawk, Wisconsin at the Packaging Corporation of America, which manufactures corrugated packaging and containers. Welding sparks ignited flammable hydrogen gas from an 80-foot tall storage tank. Unknown to plant employees, microbes were producing the gas from the decomposition of waste fiber inside the tank. Test the area where hot work is planned and eliminate potential sources of flammables, even in equipment that is not directly involved. For instance, at Partridge Raleigh, emptying and purging the nearby crude oil tank would have eliminated the source of flammable. Use written permits specifically identifying the work to be conducted and the required precautions. At the Bethune wastewater plant, there was no permit. Provide safety supervision for outside contractors conducting hot work. 2 contract workers were killed in Louisville, Ohio on October 19, 2008, when an explosion occurred while they were welding above crude oil storage tanks owned by Mar Oil. The company had no formal program to select or oversee contractors. And finally, train personnel on the hazards of hot work.
When there's any hot work involved, there needs to be additional training and safeguards put in place to make sure that the men or women that are doing the job are competent and well trained to do the job.
It's all your resources. Much training and much information about the job as well. And go into it with your eyes wide open.
Although the hazards of hot work are well known, frequent deaths and serious injuries continue to occur. The CSB believes that following the key lessons outlined here can help prevent future hot work related accidents.
All right, so that's our hot work video. And again, I show these videos mainly to shed more light on you being able to be aware of hazardous situations, right? I mean, you probably would have never really had the experience on your own, but since you came through the training, you are exposed to other parts where there's potentially value to be added. And I really believe that there is, because you being able to know about other types of hazards, again, that's what makes somebody a well-rounded safety and health coordinator. And it's part of these are required. Some of the elements are definitely required in OSHA to have the OSHA 30 card. The permit required confined spaces and hot work happen to be elective, but I think these are the ones that will have most value for anybody that's sticking into general industry, especially if you're even remotely going to be dealing with dangerous chemicals and things like that. So that's where I believe the value is added. Okay, so this module is mainly for giving you information. I want to get you guys out of here, before 3 o'clock, right? So I'll go through these and we'll get it done. And then there's one more shorter slide deck. It's going to be fall protection. And, you know, I don't want to leave your day leaving you with that kind of a image in your mind, you know, about the sad things that happen. So I am going to be playing what I like to call a palate cleanser, you know, so it'll be kind of more on the light side, you know, later. Okay, for the next video. All right. So what are we trying to accomplish here? We are going to be talking about what is hot work and what do you need to do while hot work is going on. Okay, so this is all the things we're going to cover. Okay, in this slide deck. So this is just a kind of like an overview. All right, so this is all we're covering. Removal of flammables, combustibles within 35 feet of your surrounding area. Welding blankets, fire marshal approved, or metal shields. Make sure you protect all floor and wall openings. You need to have fire watch and monitoring. We're going to talk about those. And for anybody doing fire watch and monitoring, they need at least a 20-pound fire extinguisher and PPE. And proper permit from an authority, right? So hot work need permits. Okay, and then checking for fire afterwards with what they call affirmative measures, because you're gonna have to monitor for 3 hours unless you have an affirmative measure where you can reduce that amount of time. Okay, so that's the overview there. All right, so hot work we understand creates heat and or sparks. That's hot work. That's the most basic definition. For any situation, whether it's part of production, emergency, maintenance, repairs, hot work. And then a permit is a permit issued by an authorized authority that's in-house usually, because if it's on your work site, it's in-house. So in the video you saw this says I'll consider alternative cold work methods. Well, cold work methods just pretty much sounds like that, right? So instead of using anything that can generate heat or sparks, that you choose not to do that, because either one, you know that there's some danger because you can ignite something, right? So these are the examples of those cold work methods. Now, prohibitions are basically what it sounds like, right? They're prohibited. But when you have a plan and you have the ability to mitigate or bring solutions, right? Then you are allowed to conduct operations as long as you have that plan that is agreed upon by superiors, that it's sound and you can proceed. But prohibitions include anything that can cause ignition, fire, you know, it makes it dangerous for a person to breathe, right? So those are considered prohibitions. Okay, now with permit systems, they're issued for a specific time period. And if you exceed the time period, you need to do a new permit, right? What does that really do for you? Well, it forces the next superintendent, whoever is going to be signing off on the permit, to perform all of the steps that require the permit to be signed off so that it's safe to continue, right? So what are you doing? You're doing new monitoring, new testing, right? And that's all that. So that's what the permit system is really for. Remember, a permit system is where someone's got to do something, right? And so when you really think about that process of permit system, right, is really a reminder. It's a visual reminder going, okay, did I check the meters? Did I check this section right here? So that's really what it's doing for you. That's a permit system. And then with that permit system, you need to have a master log, and then you have unique ID numbers so that you can actually identify the permits with the log entry. Okay, so that's however system that you create for that. Right? When we talk about authorization, usually the higher the cost, the higher the manager needs to approve it, right? That's all to be agreed upon. Okay, and for OSHA, if you need to provide authorization to allow hot work to be completed, can it be done through voice authorization if you're not present at the work site? And the answer to that is yes, you can. Right? It says here, voice authorization of a hot work permit may be issued, right, for hot work to be performed at remote locations. So, but keep in mind, who are you saying okay to, right? Do you trust this person? And if you don't, are you really trying to say okay? Right? So that's kind of where I leave it for you. So yeah, people say, well, no, you don't want to say yes. And you know, like, okay, well, OSHA says you can. All I'm saying is you don't have to say yes to that person if you don't trust that person, or if you don't, you know, you didn't think that they were trained properly. Right. And here's the thing too, right? If you're the person that is able to authorize that kind of stuff, and then you're not confident that that person is able to do it properly, I wouldn't say yes, right? Like, nah, we're good. Like, you know, I'm not gonna say anything. So, but if the person does allow it to happen, then the permit must be signed before you file it away by that person who gave the voice authorization, right? And then, you know, you got that situation where it's like, you said yes, something happened, you're like, I ain't gonna sign that no more, right? Right, but that's like, that sucks, right? Like, but I don't know if that's ever happened, but I was thinking about it. It's an unfortunate situation. Well, when you designate a safe hot work area, then you are to put some signage on it, right? And before you designate a safe hot work area, then you're gonna need to make sure that you do all of the proper steps to make sure that it is actually safe to do the work there, right? So the area must be free of combustible and flammable materials within 35 feet of the work. That's pretty much a standard. And if it's going to be a permanent location for a safe hot work area, then you must put permanent signage, right? And if it's temporary, then you probably just want to put temporary signage, right? So, and it says here, any underground hot work that's not performed in a designated shop must have a permit for it, right? So underground is pretty dangerous. So definitely you want to enforce that kind of a policy. Okay, so enclosed tanks and vessels. Anytime you're performing work on a vessel or a tank, then you got to make sure that you are either, you know, before you just go in there and, you know, pop a meter and then see how flammable it is, right? Then your problem, you know, the precautions, especially when you know you're entering a space that may be dangerous, then you need to make sure that you do what's called purging the containment, right? So purging the containment, and then you document it on the hot work permit. Okay, so for this, you're looking at all the distance requirements. So flammable liquids, combustible materials removed from the area, clean from combustible and flammable dust. Welding blankets and metal shields are provided as needed. And if you're working nearby any floor or wall openings, they must be all covered, protected, right? Wall, ceiling, same thing. So within 35 feet of the work being performed. So, and then if you're dealing with anything that's going to be explosive, you need to be 50 feet away of active gas lines, right? 50 feet from any explosives, lasting agents, active magazine, or anywhere where explosives are being handled or transported, right? And you cannot work you cannot do hot work when you have excess of 25 miles an hour unless you have all your combustibles and flammables removed within 50 feet, and you have other affirmative action that you've done. Okay, so remember that I told you about protecting areas nearby. The openings around you must be all protected. And then you have fire watch and monitoring. Fire watch has to happen during the work. Any break in the activity, at least 60 minutes after completing the hot work, right? This must be fire watch. You can pass it to another qualified person, so another person can take over for the other person, you know, if that's your setup. And you may be able to reduce it to 30 minutes if you have some sort of system to ensure that you are able to be notified, and you're also able to act if something were to happen. Okay, so that's fire watch. Monitoring period. So after the fire watch period is over, then you have a monitoring period, right? So following the post hot work fire watch, right? You have to monitor for at least 3 hours, and depending on what kind of materials they are, right? Then, you know, it could be potentially be shorter, okay? And it may be passed on to another qualified person. You could waive it if approved on the permit, but you know, again, this depends on the situation. And then of course, anybody who is doing the fire watch must have that equipment, 20-pound multi-purpose fire extinguisher, and any approved alternative, right? And if they need to be trained on the use of firefighting equipment, sounding the alarm, or any hot work procedures and safeguards that's going to be beneficial for that person to know. Okay, so that's that. And now these are what's called examples of affirmative measures to prevent fire. So if you can keep combustible materials wet to prevent ignition, that would be considered an affirmative measure. Right, but if you talk about removing everything within 35 feet, assignment of additional fire watch coverage, right? Maintaining effective barriers. So these are, you know, what are you doing here, right? You're making the ability to watch out for fire better, right? Because I mean, if you have, versus like in this case, versus not removing all your combustibles or flammables, right? Then you have a higher chance of getting a fire. But if affirmative measure is ensuring that you minimize or eliminate the way for a fire to start, right? So this is pretty much affirmative measures, the way to think about it. Okay, so the way you can modify the monitoring period is if you have, for instance, non-combustible construction materials, you know, there's no combustible equipment or structures, or you have wet floors, or if you're doing cold work versus hot work, then you definitely, you know, can reduce the amount of monitoring period because you did a cold work method, right? Which shouldn't have created that much heat if it's even possible with whatever you're trying to do, right? Okay, so PPE, here's the different kinds that's available. And then you have your permit copies and retention requirements, right? You have to keep them for at least a year after you're completed with them. Training must be given for the people that perform, that do the monitoring, and those that are responsible for authorizing, right? Training for them once a year. And then an audit person will make sure that compliance is there when it comes to the permit system, and they're going to report that to the manager. Okay, so real short module, right? Check this out. So this is done. We're pretty much done with this. This is the sample hot work permit. Okay, it's a sample hot work permit. So things you do before work, during the work, and then also after the work. And then who's authorizing it, and then who are the personnel. And then this one here is the hot work waiver plan. So this is where it's a little bit more involved. You have to describe your controls. You have to describe what other tools you're using to make sure that you don't hurt the person doing the work. Right. So that's the sample of that. All right, so that's Hotwork, right? Any questions? Anybody may have about it? Okay. I think we can continue on and just wrap this up. So let's go into fall protection. Yeah, we can get out of here, you know, closer to 2:45 even probably, I think. Here. Last video. Okay, so the ABCs of fall protection is about a 7-minute video plus a little bit, right? And so I will go ahead and play it now. Let's go watch. There's an ad. Yeah, let's watch an ad. Okay.
No longer will you be able to use the excuse that that's not how we used to do it. Osha has set rules and regulations mandating the use of proper fall protection. So the personal fall arrest system is here to stay. There are three main components to the personal fall arrest system. They must be in place and properly used to ensure maximum protection against falls. An anchorage point is a secure location of attachment, such as an I-beam or rebar, to which a worker may safely connect their fall arrest system. This right here, not an anchor point. Great flowers though. This right here, not an anchor point. Guess what? This right here, not an anchor point. Well, kids, there are two ways to test whether a location is an acceptable anchor point. Option A, the anchor point must be able to withstand 5,000 pounds for a task worker. The good way to picture this is to imagine suspending a full-size truck to the point in question, just like we did with Jeff's truck outside. Not again. Jeff, somebody should have told you that's not acceptable. Don't figure it out. Option B, the point in question must have a safety factor of 2 as determined by a qualified professional. This pretty much means it must be able to hold double the weight in which it will be supported. Now that you have your anchorage point, how do you connect to it? That was a trick question. The answer is it. Anchorage connectors. Anchorage connectors are links that are certified to safely connect to a proper anchorage point. These come in all different shapes and sizes. It can be broken down into 2 different categories: permanent and temporary. Permanent are devices such as a fixed keyword or a motor swivel. Temporary connectors are devices such as a workman strider or an anchorage strap. While they're not possible in all situations, it's ideal to find an anchorage point that's both above and vertically aligned with the worker. This reduces the free fall distance and potential for a swing fall. Now on to B, which in this case stands for body wear. The only acceptable piece of body wear is the full body harness. When worn correctly, it is able to distribute fall force to points on the body that are able to handle it. It is essential that the body harness is snug against your body. Body harnesses are not one size fits all. They come in a variety of sizes. Here's an example of a size chart to determine which size harness will be best fit for your body. Upon first look, the body harness seems simple, but there are many components that make up the full body harness. Padding, webbing, and hardware such as buckles and D-rings make up the device that may someday save your life. It's also important to note that not all harnesses are made for all jobs. Check your tags to ensure product specifications.
The connecting device is the line that runs from the harness of the worker to the anchorage connector, completing the personal fall arrest system. Generally speaking, there are two types of connecting devices. The energy absorbing lanyard, the self-contracting lifeline. There are a few options for the type of connectors on these devices. A snap hook is the most common type of attachment. A larger version, known as the rebar or pelican hook, is also available. Carabiners are another option that you may see on your connecting device.
All connectors must be auto-closing and auto-locking per OSHA standards. It is absolutely unacceptable to connect two snap hooks, two carabiners, or a snap hook and a carabiner, in a term we refer to as hard linking. It's also unacceptable to choke load or tie a lanyard back onto itself unless it's a specifically designed lanyard. So you have your lanyard and your connector, but what is this little pack on the end?
The purpose of this pack is to stop your free fall by decelerating the rate of descent until you come to a complete stop. There are two different styles of energy absorbers, a rip style and elongation, as seen here in our diving energy absorber lanyard.
Enough about lanyards. Let's talk about SRLs. A self-retracting lifeline, or SRL, is a device that contains a drumwound line. It may be extracted or retracted back into the device during normal movement.
While SRLs are attached directly to an anchorage connector, smaller devices, known as personal fall limiters, or PFLs for short, may be worn directly on the worker's back. Like lanyards, there are a variety of SRLs, including some with rescue capabilities.
Now that we have all the components of the personal fall arrest system, it's essential to have a rescue plan in place.
Be sure that trained rescue personnel and proper rescue equipment are present.
The average rescue time is 15 minutes, and let me tell you, you don't want to be hanging like this for too long. Remember, a fall arrest system is just that, a system. All of its parts must be in place and used so you can stay safe. But when in doubt, revert back to your ABCs. And remember, safety is on your side.
So, right, so I want to make sure I didn't leave you with sad faces for the day. All right, so fall protection. You know, in the first day, we had covered a little bit of it in the walking working surfaces. So now it's just a little bit of a deeper dive. So, first thing to cover is the height requirement. So if you are exposed to a fall that's 4 foot or greater, right, then you will be required to have a personal fall arrest system. So we're going to identify the fall hazards that are associated with the workplace, and we're going to identify methods to eliminate or protect against fall hazards. Okay, so here are the different types of fall hazards, right? In there. Next one, floor openings, wall openings, shelving units. Those are some hazards there. So the goal is you want to try to bring the work to the ground, right here, instead of trying to climb up to the top and you're not protected right there. This definitely, there's no protection there. So when it comes to fall control, your hierarchy is, first line is to eliminate the fall hazard altogether, right? You don't want anybody to have to face a fall if they don't need to. And then the second line of defense is to prevent the fall. The third is to control it. Okay, so try to work from the ground. Or if you need to see something at heights, then use a drone, right? It's probably what's a really good, so it's a really, now we have the available technology, might as well use it. Okay, so eliminate the fall hazards with covers and grates. Make sure that they're secured, hinge, latch, lock, things like that. And then you can prevent the fall by ensuring you have a proper standard guardrailing system, right? Top, mid, and your posts, right? So your top height is 42 inches plus or minus 3. Mid-rail height is 21 inches, and then you keep your toe board at 3.5 inches high and not more than a 1/4 inch clearance from the floor. Okay, so you can barricade. So if you're going, second level is if you can't eliminate the fall, then maybe you can protect people from the fall by barricading the area, right? So that eliminates them from having to, prevents them from having to get past that, right? But of course, this becomes a authorized access area. And then of course, once they get past that authorized access area, then they must be provided with the right type of tools and equipment to prevent them from being hurt if they have to do any duties of climbing. So preventing the fall, the next level 2 is fall restraint. So instead of fall arrest, right? Because fall arrest means that you're imminently going to fall and you want to prevent, you want to stop the fall, right? That's fall arrest. And when you talk about restraint, we're talking about preventing the fall by keeping you safe off the edge, right? So ABCs, anchorages, body harnesses, and components. If you remember seeing this on day 1, it's the same slide. And then I like showing the video because in the slides here, they only show you like pretty old equipment. And then, that's a newer company, that MSA. And, they have to stay more fun because, they're trying to market to companies, market to construction people, right? Especially when they're doing a lot of work that involves needing personal fall arrest, right? So that's their business model. All right, so here's some of that. Here is a full body harness. Here's your connecting components. I just remember the videos are great. Like they like showing all this stuff in there. Now let's talk about controls. Okay. So you have your positioning devices. So positioning devices are pretty much devices that allow you to stay on a higher level while having the ability to keep both your hands free while maintaining 3 points of contact. Right, so that's positioning devices. You could just say that's pretty much what its intention is. And then you can control the fall by having a net system. And then of course, employer must provide training on the hazards of the fall, protection methods, proper using of any system that's being implemented, and any applicable OSHA standards. Those are the training. And then before you actually do the work, then you have to do inspection, inspect the workplace for any potential fall hazards. And then you must make sure that you use all the controls, right? Guardrails, covers, grates, anchorage points, and make sure that positioning and fall restraint hardware, you inspect it before you use it. Right? That's a very important step. Inspect it before you use it. All right, so when you have a system in place, right, then part of that system, part of that plan requires that rescue plan, okay? A rescue plan that will get the person off of where they're hanging from if they so happen to fall. Right, so these are another situation probably too where you might need to have emergency services ready on hand if someone does fall, and that way they have the ability to get someone from there, right? Unless you have a trained team that's in house, but whatever that is, you have to have a plan. All right, so let's take a look at some of these photos, and we're pretty much wrapped up here. So can anybody tell me what are the issues with this photo here and why? What can we do to protect this person from hurting themselves? Anyone? Right, so you can see that there are no guardrails whatsoever. He has no personal fall arrest, right? So what's this guy doing? And what should he be doing? This looks like it's more than 4 feet, in my opinion anyway. So is this guy just crazy or what? Probably, right? Okay, so definitely he's got no body harness. He's not tied off to anything. Yeah, so he's asking for painful endings here. All right, how about this person right here? What's this problem? Do these guys have a death wish? You know, it's like, you know, maybe if I pass away on the job, then you know I'll my family can get help because my employer didn't do their job, right? Possible true. So, but yeah, they should have had some type of personal fall restraint device system, you know, to help them keep themselves safe on there. That'd be a good idea. Okay, and then how about this picture right here? What's the problem there? No guess. Well, that's a pretty big problem when you have a open pit like that, where someone can just fall in there, right? That's probably not a great idea. All right. So let's do a last knowledge check here and check out for the day. Right. So please remember to sign my sign-in sheet tomorrow. All right, I'll come find you. Don't worry. So just be ready for that. And so, what is the first line of defense when it comes to falls in the workplace? What's your mindset there? Anybody? Well, yeah, yep. You want to eliminate the fall completely. Perfect. All right, that's one. Number 2, a worker is required to remove a section of guardrail in order to receive materials from the fork truck. What's the following best solution to prevent them from falling?
C.
Well, you gotta remember, so using a fall restraint system is the best answer because what are you trying to do, right? You want to prevent them from falling. Good. A personal fall arrest system anchorage point must be capable of handling how many pounds? You guys see the video? If you saw the video, then you know the answer.
4. C.
1 more thousand.
Oh, D.
5,000. Yes, sir. Okay, so look at that. We got done in 10 less minutes than I thought. Okay. All right, so that wraps it up for today. That is pretty much OSHA 30 for the week. We're done with the whole week. If does anybody here have any questions to ask about anything that we covered at any point? I'd like to make sure that at least answer any questions that you guys have.
I'm good
Okay.
here.
Good there, okay. All right, and I guess if there's really nothing else, if you want to watch, if you want to rewatch this session, then it's broken down by the day. So I'll upload those, and then if you're so inclined, you want a copy of it, or you want to get the link, then I can definitely share that with you. Okay. Well, if there is no other questions, right, then you guys have yourself a great day. We'll see you here tomorrow. Now, again, I'm just telling you guys, I know you're coming from wherever you're coming from. So, if you just at least try to shoot for getting here at 8:30, then you might end up getting here by 9. All right. So we'll see you tomorrow, and you have yourself a great afternoon. All right. Take care. See you guys later.